Am I close enough to the camera?
You gonna print for us?
I thought I was seeing my big head.
It is 5:38, and welcome community members and everyone to our board meeting. While the mask mandate has been lifted by the governor of the state of New Mexico because this meeting is taking place within the Navajo Nation, the board is complying with the more restrictive provisions of the Navajo Nation Health Code. As a result, the district will continue to conduct its meetings held on the Navajo Nation consistent with the practice it has been using during COVID, so as to comply with the social distancing orders. This event will only be available to the public via live streams on the district's YouTube channel at the link following. This meeting is closed to in-person public participation. Ms. George.
Yes.
Ms. Asmus.
Here.
Myself. Mr. Ray is not here, and I understand that Ms. Haskey is going to call in later. We have a quorum. We have no comments from the audience, and I have to be read into the minutes.
You might say where that he is here, but went on to the.
Mr. Montoya was here earlier, but has gone to the meeting with the PRC
Yes.
at
Phil Thomas.
Phil Thomas. And he will return and join us later. Item 3, June 13, 2022 board retreat. On June the 13th, 2022 at 3 p.m., a quorum of the board was present at Kirtland Boardroom in Kirtland, New Mexico for the purpose of conducting a board retreat pursuant to a notice and agenda issued on June the 10th, 2022. Prior to convening the board member Asmus raised a concern as to whether the notice was not proper under the New Mexico Open Meetings Act. After consulting with the board's legal counsel, I determined that the retreat should not go forward, and all board members left. During the brief time that a quorum of the board was present, no school business was discussed and no action was taken. Number 4, reports. MOA and MOU of universities and colleges with CCSD. That report has been, needs to be tabled.
Yes, sir.
Is that correct?
President Wells, would you like me to speak on that?
Would you, please?
Absolutely. This was a request from the board recently, and we will be happy to compile that report. However, the person who will do that is Tanya Amrine. She was not in the loop recently on the memorandums of understanding and agreement. And so she's agreed to help us out in a pinch. She will have the first part of that report ready on Tuesday at the board meeting. So we can put that off until Tuesday when she will begin that report.
Oh, do we need a motion to table?
No, I think it's just read because you don't have it. It's just part of that board retreat.
No, the MOU and MOA was not part of the board retreat.
Oh, yeah.
I need a motion then to table.
When we do the action items, we can do that.
Okay, all right. Next item is report on the CLIA licensure by Amanda Sutherland. Ms. Sutherland?
Good evening, Board President, board members, Superintendent Carlson, community. I wasn't really sure what I needed to provide other than the certificate that we do have a CLIA waiver in place, and it's effective until January 18th, 2024. And what this CLIA waiver does is it covers only the test to stay program so that we can administer the rapid COVID test. And we are able under this CLIA waiver to do QuickView, iHealth, and BioNext now within the schools. And I stand for questions.
This is gonna sound retarded. What does CLIA stand for?
It's the Clinical Laboratory Improvement Amendment, and we're giving the districts operate under like our nurses, they operate under a license, and their license currently do not allow for diagnostic testing, which the COVID test, the rapid testing is considered. So we had to get the waiver and get our nurses trained, which they were, and now we are able to provide, it's called the program from PD Test to Stay. So if close contacts of a positive person within the school, we can administer the test. And we're also able to use them for surveillance testing, which is required by New Mexico's health order.
Okay, thank you very much.
You're welcome.
Any other questions?
Yes.
Ms. Asmus, go ahead.
So, Ms. Sutherland, giving this report, the MOA, MOU, the second one, the report on CLA licensure. And you're asking if we have any questions, and all you did was introduce a certificate. So I'm wondering, what questions are you normally asked?
Thank you for the question, Board President, board members. I was asked that this was something the board wanted a report on. And so the last that I remember that in December, the test to stay was part of a health order through the governor. And we needed the CLIA waiver to get the nurses trained in order to do the rapid testing in the schools. Before that, we weren't allowed to do any of that. We were able to get the CLIA waiver, as you can see, in January, and it'll be in effect. So what I was asked to present for the board was the waiver. So that's what I meant by I'll stand for questions, because that's all I was asked to provide.
It looks like it's good until 2024.
Yes, sir. Mm-hmm.
Is that right?
Right, but like I said, it's only for the rapid COVID testing, and so we're using the anti-agent testing, and the test that we're using is QuickView, iHealth, and BioNext now.
Board President, can I make a comment?
Yes.
I would just check the spelling or have that corrected. This is a certificate waiver, is supposed to be an official document. Our school district name is incorrect. Thank you.
Yeah.
Oh, yeah. Mhm.
Yes, I think we haven't gotten the corrected one yet. But we did ask for that to be corrected.
So, in the fine print there, it looks like the certificate should be valid until the expiration date, but it's subject to revocation, suspension. How is that? Limitation or other sanctions? How does that happen?
So, as I stated, so we can only use it for the anti-aging testing. So if we went outside of that scope, then we could potentially have the consequence of losing the license or the certificate to work under the waiver, and we would not be able to provide that service.
And they don't issue that service on the certificate on what it's being given for?
Correct. So school nurses function under a license through the PED, and they're limited with their scope of work. And it's different than as if they work in a hospital. And so this waiver came through DOH when the emergency order came out, and then they had a program through the governor's health order called Test to Stay, and the districts had to get a CLIA waiver in order to participate in the program, which allows us to use the rapid anti-aging testing for staff and students that are identified on campus.
Okay, thank you.
You're welcome.
Are there any other questions from the board?
I have a question. I have a couple of questions.
Yes, Ms. Short.
So, have we had any reimbursements from Medicare and Medicaid for these rapid tests that we're doing for students and staff for reimbursement, Medicaid billing?
So these were free, the tests, and so they don't flow through the Medicaid, and the testing is not either. So we had to pay for the waiver, and but the test kits have not been a cost to us.
And the Test to Stay program, are we still tracking staff who are positive and getting those reports?
Yes, they're still following the same process that the supervisor sends it to the COVID email, then it's sent out to the various people, and then we do check-ins with the staff member that's not well, and then it's documented, and PED is not requiring that documentation anymore, but environmental health still is, and PED does require us to turn it in through a portal that we work with data on. Dr. Ben Baden and HR work on that.
Okay.
We're still required to, employees are still required to let us know when they've tested positive.
Are we still using the app on the phones for staff before they come into the building?
We should be. As far as compliance with that, I can't tell you at this time how many people are. I did not use it this morning because I left at 5 o'clock in the morning, but generally I have been.
Because I know of one situation where there was a staff member that was already here in the building and was positive, and if they use their app, they wouldn't have been in the building, and they would have stayed home. And so I know that it's not being followed as strictly as it used to, and that was here. And we're still, Navajo Nation still on a big mandate, and the numbers are going up. So I think that we really need to be enforceful of that and check on the staff who are not vaccinated as well, because they're the ones that need to be tested every week.
Thanks, Secretary George.
Mm-hmm.
We will definitely look into that and make sure that we're still on that. And I'll make sure, I know now it's mostly central office folks who are working. Schools have a little bit of summer school left. But for those staff who are coming in, they still should be using the app. So we can make sure we put that back out there.
Okay. Right. No, I have no other question.
What does that app entail? The one you're talking about?
So if you go into the app, looks like this. Like I said, I haven't done it, so I can still do it. So it just asks you to do a COVID screening. I'm still tied to doing this. And you ask 5 questions. Do you have symptoms? Have you been around anybody who's tested positive? Do you have any, or I don't know, the first one, that one was symptoms. Based on temperature scan today, is your temperature more than 100.4? No. Are you taking anything to reduce fever, ibuprofen, Advil-Motrin, or acetaminophen? If you click no on all those, then it gives you a green check mark to go ahead and enter the building.
Okay,
It's pretty
and
simple.
yours is the same way?
That's the same. It should be every district person has access to that to put on their phone or to go into the building when you get there and do those questions before you actually get into the building. That's how they were tracking
Is
it.
that the same questions that they
Yes, on the
have to sign
paper.
on that paper out there?
Yeah, when you sign in over here. And my other question is, for the COVID, why isn't the COVID coordinator reporting to us, Mr. Verkos? Isn't he the COVID coordinator?
There are 2 different folks who deal with it. One is actually Christy Brown, who is in Amanda Sutherland's department. We can have, if you would like, we can have each of them.
Yeah,
we can get down to where we do the board meeting reports and put it on there as well.
Yeah, because if they're responsible for that, I think that they're the ones that should be reporting.
Okay. Also, I find it funny that that we do all these things and we're under 2 different guidelines with state and tribal, but how come the board doesn't know about this app? How come are we just relying on the paperwork? And I myself, I just came in through these doors. I didn't go through the secretary. And then is that why my phone keeps, giving me the New Mexico Department of Health?
I don't think it's too side.
I'm just, these questions are going through my head and but the main thing is if we're doing this with the district, within the district, then how come the board members don't know?
That's a good question. We've been doing it for
since we started coming back into the building.
Since we came back to the building, the app's been available for a year and a half.
I've seen the paperwork. It's been here, and we answer the questions and put them aside, but since then the new board members have come on. I haven't seen that paperwork.
Okay.
And I don't know. I'm just wondering. And is it really being taken seriously? And again, Ms. George brings up a good point. And this has been something that's been 2 years, something ongoing that people in those key positions which you think would have that knowledge and that background, that information to give presentations are not. And then when we ask for that, time goes by, and then I'm sitting here, just as earlier when I pointed out, I don't know what questions to ask. This all we were presented with was a certificate, and I think your cabinet needs to be, these presentations need to happen in a way that where we can understand, in layman's terms, and not only that, the most important audience on here is our community, and some of this stuff we do know, but a lot of our community members, our viewers, they don't know, and so that needs to be kept in mind, and it's not till later that you hear, you should have asked this, you should have asked that. So I think they know in those positions, they should know what are the burning questions, and be prepared to answer some of those.
Sure.
So I have another question.
Yes, ma'am.
So you said the nurses are were trained. Is there a delegation process that is allowed for the nurses to delegate to health aides to do the saliva test or the testing for COVID?
Yes, great question. So the health aides the health assistants, and the nurses were all trained.
But you mentioned that the nurses, never mind. I got it. Okay. Okay.
Anything else?
No.
Ms. Husky?
I don't have any questions. Thank you.
No.
Okay. Thank you, Ms. Sutherland.
You're welcome.
Next is C, end of year report on medical billing and services.
Medicaid.
You're still Medicaid? Oh, excuse me. Medicaid billing and services.
It's full of me tonight, I think. So we were asked to give an end of year report. And so I just first want to give a shout out to everybody that helped. This was not just a one person endeavor. So I want to acknowledge Cheryl Jones, who is our Medicaid specialist, Christy Brown, who's our ancillary health and wellness coordinator, Becky Brandt, early intervention special education coordinator, Crystal Arvizo, she's our student support financial specialist, and then Dom Atty, he's the financial grant specialist in the finance office. So we put together this presentation for the board. So this is a snapshot of our revenue report for the year, which just goes through May. So right now we're sitting at $800,000, a little bit more. And this will go up when we get our last payment from our cost report. So how we generate the revenue for Medicaid is through our special ed students. And this is just demographics for our population. We have 831, and we have 300 out of the 800 that are ELL, 41 autism, 148 that are identified as developmentally delayed, 25 that are identified as emotional disturbed, 4 hearing impaired, 414 are specific learning disabled, 51 are intellectually disabled, 52 other health impairment, 19 multiple disabilities, 69 receiving that are identified as speech and language impairment, 6 that are identified as traumatic brain injury, and 2 visual impairment. So the spectrum of programs that we offer are, we have 2 behavior classrooms in the district, 6 classrooms for the life skills class, and that's for our very high need kids. Then we have 5 classrooms for what we call extended resource, which these students are still able to participate in some regular ed classes. Then we have resource at all levels. We have 5 autism classrooms. We have 10 4Y programs, 4 3Y programs. All the schools participate in inclusion classes for our students with disabilities. We have 2 students that, because of their medical needs, are on homebound. We have 12 students that attend that receive services from our district in the Navajo Head Start, and 2 students at PMS Head Start that receive services. So our related service staff, they're, and which I'll get into the billing as we go. So when we're doing billing for Medicaid, it comes through these ancillary providers. And so through that, they work with a program called Max Capture, and we're billed by the services that they provide and the notes that they give. So we wanted to add the non-clinical social workers, which we also known as CAT. And what the exciting thing that's going to happen is they have never been able to bill Medicaid before due to their licensure and just in New Mexico, servicing general ed students was not a Medicaid service. However, starting July 1st, we'll be able to start billing for the kids that these non-clinical social workers are seeing as well. And again, staffing plays a big part because when we're looking at our SLPs, our OTs, nurses, they generate 33% of their FTE is reimbursed. So the more that we're staffing, the more that we're billing and taking our notes, the more that we're generating that revenue. So we have the RNs and the LPNs, and they're able to bill the nurse. Just the RN has to sign off of the LPN's notes. We have 16 health assistants. They unfortunately don't generate any Medicaid billing or funding, but we did use Medicaid to staff all the schools with a health aide. When I first came in 7 years ago, I think we only had a couple of nurses and a few health aides that had to oversee the whole district. And so that was one of our initiatives that we wanted. If we couldn't staff the nurses, if we couldn't find the nurses, then we knew the schools at least needed a health aide. And then we've just built upon that.
May I disrupt? So on those health aides, are they under that certificate too?
Yes, they've been delegated. So they work under the nurse and they're able to provide the testing. They have the training, the specific training.
I'm talking about the certificate you just.
The CLIA waiver. Yes, ma'am, they're covered.
Thank you.
And then we have the occupational therapist, and again, they bill their services, they take notes on their therapy, and that generates the revenue. And then we have, they're called CODAs, they're assistants to them, but they're certified occupational therapists that work under the direction of an occupational therapist. And the same as the RN, occupational therapist signs off on their notes, and we're able to get the revenue from them. We have one physical therapist, the same. And then the clinical social workers are the ones that are able, they're at a higher license level, and they provide the services for our students with special needs. And so again, they are able to capture their notes and their time within the max capture, and we're able to turn those in for the funding.
I have a question while I'm thinking about it, Board President.
Yes, go ahead.
Are these services, the clinical social workers, the CODA, the occupational therapists, the physical therapists, are they virtual teleconference or are they in person? And are these people employed by the district, or are we contracting services outside the district for these services?
It's both. We have district and tele.
How many are tele? I guess just a percentage.
Can I come back to that? I do have that somewhere.
Sure.
I'll get that to you.
Thank you.
I'm in my office, so then I would have the notes, but I don't think I have that, but I'll get them. I know I have a paper somewhere. But yes, and they are a dual, but for the speech pathologists are the hardest that we have. So those are the most that will be online. The others, we do have our PTs on site, and our we have one OT on site, a CODA, 2 CODAs that are on site. So the again, the speech language therapists are our biggest teleservice. But they also are able to we get the money for their FTE, the 33% back, and they also provide the max capture notes and services. And we have one.
I have another question, Board President.
Go ahead, Suzanne.
In regards to the tele and the employees from the school district, are we billing the same amount, or are we billing differently based on whether they're teleservices or if they're in person? Is there a variation in services? So are the time provided to services provided to the student, are they more or less or the same in terms of telework, teleconference, and in person?
Another great question. They are the same. So they just pick up the IEP service that's indicated in the IEP. And so and again, their billing for Medicaid is exactly the same as if they were on campus. And their notes, they still have to follow the same format for the notes and the indicating their service time.
I have a question. So with the with this speech language, I know there was a couple of parents that weren't too fond of the tele process and method. So, and this was way before COVID. So it's probably been about 3 years. And so since then, and it was brought to the attention of your department. And so since then, has there been any speech language that is in person?
We have the assistant therapist that's in person. And so what we did after, you're correct, we absolutely had to go back and I had to work with my team, and we pushed it out to the principals and the IEP teams that absolutely anytime that a parent didn't feel comfortable or didn't want, then we needed to have a meeting through the IEP and discuss and work on that and change kids' schedules. We actually had parents that wanted to sit in, and we made that available. So we're really just trying to work hard with the parents, knowing that we're in this situation and we want them to be comfortable. We want their student. Sometimes there's been times where the speech pathologist is like, they need more face to face than what I could offer, and so we'll make that happen. And we're constantly trying to recruit and bring people in. It's just a difficult, I want to say genre, but I think that's the wrong, but speech language is very hard to find in person people that want to work in the school districts, and that's all over.
I can't imagine speech language assistant virtual. That'd have to be extremely hard.
Yeah.
Mm-hmm.
And another thing, when we do RFP on this, do we specifically ask for in-person, or do we leave it up to their convenience?
No, ma'am. We absolutely, our first priority is in person. That's our in person. And
I mean, if that's our priority or your priority, but we're still doing the videos.
I know. Unfortunately, there's not in person candidates. That they can't find us in person people.
And where are these? What schools are provided this in person?
Becky might be able to. Do you know off the top of your head, Becky?
We have one provided at Mesa, who's providing in person, plus our Head Start schools. And then we have at the Early Childhood Center in Kirtland, we have the ASL provides services there because he has to be supervised. So he's supervised by the ASL at Mesa. And he also does Head Start students.
And this is the assistant?
We have an SLP who's in person and an ASL, an assistant that is in person.
Okay, that's two.
That's two that are in person. Yes, correct.
So we only have two people doing in person?
Correct.
That was the whole reason why this was brought up years ago. And it's ongoing because we, especially with Yasi Martinez situation and that filing, parents in Newcomb and Noshchitty area could come back and say the CCSD is failing. And we're not being equal in that method. We could just easily say, oh, at least we got a video. But and again, when that discussion came up about them being contractors, and we usually, when you hire a contractor, they fit to what our needs are, not making them convenient. Meaning we need somebody at Newcomb and Noshchitty. So it's something that we're, as Mr. Carson, that we need to work on. And because the ones that lose out are the kids. that specifically need this. Thank you.
Board President,
Yes.
Board Member Aspis, if you don't mind, I'll kind of answer that just a little bit from my perspective as a building principal, and having gone through that with parents as a principal, asking central office to provide those services. So we did have a teletherapist, and I was very much against the teletherapist, because I was like Mr. Wells. I had a hard time imagining how that would work. So I spent quite a bit of time in that classroom. And I will tell you that, especially among students where there is a group of students, in most cases, a teletherapist can make inroads with students in speech. It's something you actually have to see. I would prefer in person still, and everybody on the call here, they would as well. And I found since taking this position that they have made some efforts to try to get those people. It's a nationwide paradigm shift where SLPs have decided, you know what, I can do this work online. I don't have to go to these places. And so this is really, really difficult. So what we can do, though, is we can try to have conversations about perhaps there's perks, perhaps there's other things we can do to entice folks to come to our district. Because I agree with you. It would be better to have in-person therapists for speech and language.
Well, as I said, contractors, they get into a business, they do their business as they see fit, and they want to do it. But when they come to a project and the customer needs something specifically, it's either yes or no. And if they're willing to go ahead and provide that, then it's to the customer's needs. And right now we're getting those contractors that, you can't tell me that we don't have that need out in Newcomb and Chitty.
We do, absolutely.
So we need to do better.
If we're unable to find someone to contract to do that, then what do we do?
Well, I don't even think we have challenged it.
We haven't applied for it, is that what you're saying?
We haven't challenged it.
So
You mean we haven't challenged the contractor? Is that-
Yes.
Okay.
We're getting money for Impact A. We're getting, we as though didn't directly, but Yazi Martinez, we're getting something out of those court winnings, and yet we still have this inequality, and we shouldn't have that.
I have a comment, Board President.
Go ahead, Ms. Haskey.
I was wondering if the surrounding school districts have the same issues as we do. I was wondering if it isn't really the case, and it's specifically because of our location for our school district, if there's a way to share the services with our surrounding school districts, if that's a possibility to at least have the in-person, if we were able to collaborate or partner with other school districts to share those services, face-to-face type of services, instead of having tele whatever those services. Thank you.
I believe Ms. Sutherland was trying to answer that a little bit, or would like to.
Go ahead, Ms. Sutherland.
Thank you, Board President. So I do sit on a monthly committee with the surrounding area directors, and the last, Farmington, Bluefield, Aztec, never had a problem with finding SLPs. It was always us. And then now they're actually having to turn to teletherapy as well because of exactly what Mr. Carlson was saying. The therapists are turning towards working from home instead of coming. So it's a nationwide event and not just CCSD anymore. It's becoming very difficult. We had an SLP that actually left us and started working remotely as well. So we've talked about the incentives to in-person and trying to get people to come and work in districts to give these services. We are just as Ms. Aspis was saying that we're in a quandrum because we are to be providing these services due to their rights. It's in their IEP, their individual education plan, which is bound by law, and under IDEA, it is the services have to be provided. It's a civil rights issue if we do not provide the services, and so that's just kind of where we are. But I just want to be transparent and leave you with good faith that I myself and my team, we're definitely always trying to find ways to bring in people.
So with this discussion, to be fair about this, maybe I should come and ask this question. Okay. I mean, who would have thought we would be having Zoom meetings in the past 2 years? So I know that we've taken a turn, but nobody has come to the board to convince and say that it's better or it can be done. So until I see that presentation, maybe it's something that we do need to see, and because we do have parents out there, and I have had two of them, two sets of parents that did not like it, and so. But again, we have not seen, but since then, only one has continued, but the other one seems like they're comfortable with it, but maybe that's the what we need to see as a board to be fair in this, and see if it what we are doing in situations like that for the special needs kids.
I think it's a great idea.
Mm-hmm.
I think
We can definitely put, we probably wouldn't be able to use a student, but we could do definitely get one of or a couple of them to do a live presentation or talk about their therapy and how it works. But I do want to be clear, we're not, no one on my team, or I don't even believe, we do not have, our stance is not that this is better. Absolutely not. We know that in person, having somebody in district is always, that's the best. We're not promoting the online as a better option or anything like that. I just want to clarify that we know that having somebody in district is going to be our best.
Thank you.
Yeah. And I just want to say, because my heart, the passion that I have for special education and the students, and making sure the families and the students are advocated for and protected is just part of who I am. So for the new board members, I just want you to know that I will do whatever, and I'm willing to try and hear. I love to hear the new ideas, and I think our staff would be excited to present for you. So continuing on, we are looking for an audiologist, but I believe we're in the process of finding somebody to contract. Go ahead. And so back to just the Medicaid. So although our diagnosticians, they're not a big Medicaid biller, but their first evaluation we can bill for. So they're able to bill Medicaid for this, and which we get reimbursed. And we have one vacant position that we're hoping to fill soon.
I have a question.
Go ahead, Ms. Adams.
So on the, as you talk about revenue and what's generated, how does that show up on the report, the finance report? What is it under?
So we can go back to the, Sharon Ray, if you want to go back to the first slide. So we, it's a complicated process, but in short, that we do cost reports and other reimbursable items, which I'll talk about in a minute, but this will show up on this report. So right now we average about $1 million or so. And like I said, this is just through May. So we should get our next payment, and that'll bump us back up into the million range that we're able to get reimbursed. And then the next slide that I was fixing to go into, I was going to try to explain a little bit.
Is this a separate reporting from your department, or is this included when Donovan does his reporting to us by month?
Excellent question. Yay. So we actually asked for this from finance. So yes, he does give you those reports in his, when they come through, he does that in his financial reporting. We just wanted to include this when we were asked to provide information. And so I asked Dom, and he provided this for me.
Okay, and I've seen this before that, and I thought it was employees,
Yeah. No, yeah, it's exciting. And I have to say, this is an area that we've really been working on, and we've actually increased our revenue off of it by staffing everybody appropriately, by making sure that that cost report is done correctly, which I'll go into a little more detail on the next slide. I think we're ready, Sharon.
Amanda?
Uh-huh.
I hate to say it this way, but I don't know how else to say it. It's probably bad, but so that report that you showed us, the revenue report, and these being contractors, how is it that the district is making money?
Well, let me tell you. So, other facts to know. So, when we get our SEG units, they're generated by the ancillary FTE when services are provided, and they're coded to 11,000. So all our nurses, OTs, our clinical social workers, we get 33% reimbursement on their FTE. So that goes into the revenue. Then we have the Fairbanks random time study, and that's and I wrote it out, staffing services, so SPED teachers, nurses, health aides, school counselors, 120 AAs. There's a list of faculty and staff that can do these surveys. So the district must be at 85% quarterly, but we're since 2017 to current, we've been 100%. And we owe a lot to that to Cheryl Jones, because she's our Medicaid specialist and she stays on top of that. She is making sure when those surveys go out that they're getting turned back in a timely manner. So how it's done is you'll get I'll get a survey, a nurse will get a survey, and it'll ask you what you were doing at that time. So anytime that you're with a student, then that generates also some funding. The next slide. So that's how we do it on the people. Then other facts to know. So our AEDs are 100% reimbursable. So the AEDs, the batteries, any kind of work on them is reimbursable. And again, this is a year out. So it's prior year budgeting. So what you're seeing, what we get is always like a year behind. It's generated off that 80 and 120th day too, which is a whole complicated. But in short, 80s are 100% reimbursable, which all the schools now have updated, and we've increased our number of AEDs as well. Health office supplies, we purchased through Medicaid, but then it's also reimbursed. We're using a SNAP program, and that's a health office documentation program, because the nurses and the health aides have to document every visit, the medication forms, any kind of information goes into that SNAP program. And then again, like I said, starting July 1st, the Medicaid billing will include all regular education students for nursing and behavioral health services. So we should even be seeing an increase not next year, but the following year. So those are all the ways that we generate through Medicaid.
So that collection of all that information, vaccination information, medication, office visits, are those all confidential?
Yes, ma'am. That's the beauty of the SNAP as well. It keeps it confidential, and then only the health office are able to access.
And these are kept at each school, or are they?
Yes, yes, ma'am. They're kept at the school, and they use their computers to log in. So it's a computer system. It's a confidential computer. It's a confidential platform.
Okay.
Anything else?
Is she done with her report, or is she still recording?
She's still going.
Okay.
Go ahead.
I think that was the last slide.
That's your last item.
Mm-hmm.
Okay. You got a question?
Yeah, I have several questions.
Uh-oh.
Can you clarify the SNAP? Because I know that for me, SNAP, by the way, is the food acronym for people who are on food benefits. But can you explain that for the rest of us? Yeah.
So it's school nurse. I can't remember what the A program.
Okay.
Let me see if I can find somebody. I'll have Christy check me. But yeah, it's an acronym for the school nurse program.
Okay. And
my mind went blank. I'll get that for you though.
Okay. And then it's an internal documentation for medical, but who's overseeing that? Where do those information sit? And then is it still following the process of when a student reaches age 19, their medical records are destroyed, or they can come and get it if they sign for it, and then the last documentation in a medical file in the health office or for any medical services provided, you have 10 years from that date that's documented in the medical notes. How is this system handling that process?
So from my understanding, and I can call Christy and see if she can get online, but because she's the health and wellness coordinator and oversees it. But from my understanding that it's kept there online, and then we do like all our other records. We have not moved any of our IEPs or individual education plans to online, just so we've been asked not to do that by our attorneys. And so we still have to follow the NUMAC guidelines for destroying of records. And so we would follow that process. We would make sure that parents are notified that they could come and collect them. But that's all I can answer right now.
So office visits, medication forms, vaccinations, are those, is the SNAP just the health office then? Is that all it pertains to, is health office services?
Yes, ma'am. It's only meant for the what's happening in the health office.
Okay, so with this, is this shared with school-based health clinic like IHS? If they come and see a student, is it shared with IHS doctors as well? Because because you can't sell it, or the contract has to be signed. And so I just want to know where it sits, because it's gonna, we have a what do you call it?
Hold on. Christy's on the phone. Can you hear us?
No, I was on there, but
Oh, I lost her. Shoot. Okay, I'll try. We can do another whole presentation on SNAP if you'd like.
Okay. Okay, and then going back to, you said that for the 504 meetings that the clinical social workers, they bill for that, correct?
Not now, but in July, and we'll get more surrounding that, more guidance, but for their behavioral health service. So when our non-clinical social worker does a group, they'll be able to actually document and bill for that. Whereas in the past they weren't able to. New Mexico only was under Medicaid billing for students with disabilities for but now they've opened it up to the other venues.
For clinical social workers, can you explain why they're not billed higher? Because that's the biggest part of COVID right now, and it's mental health and crisis. And why are they not billing higher?
Let me see if I understood the question. So our clinical social workers that work with IEP students, they're billing. So there's not a level of higher or lower. It's the non-clinicals do not have a license to work with the students with disabilities. So therefore we were never able to bill for that service. But now when starting in July, we'll be able to they'll be assigned to Max Capture. They'll be able to code their services and leave their notes, which will generate funding for us.
Okay. And I just want to be really for the teletherapy. They're not in person, so their documentation needs to be turned in. When they see a student, that's an advanced service because it's teletherapy. So their documentation, Medicaid diagnosis, their patient care notes to those student serves, they're still obligated under the CFCC, which is the Council for Clinical Certification in Audiology and Speech Language Pathology. Those certified holders are expected to uphold standards of care and abide by ASHA, ASHA codes of ethic. That's the American Speech, Language, Hearing, and Association. And so they really need to be on top of doing their notes and turning them in for billing. And just as if they were in person, because our one, you said we have one SLP for the whole district, and that SLP has to get the documents, the notes, and everything turned in for Medicaid, for reimbursements, and all of that. And I just want to make sure that these contractors that are on teletherapy, that they're doing their part as well. They're doing their notes and they're turning them in on time so that the billing can happen in a timely manner. Yes.
Yes, ma'am. And that's where our team is working so well together. And Cheryl Jones is great at monitoring that max capture, and she communicates with Christy, and then Christy will reach out. But we've improved so much over the years on all of that, and we're just continually looking at our gaps and trying to close them. But yes, that's definitely one thing that we're monitoring closely. And again, we really appreciate the diligence that Cheryl Jones puts into this, and it's working well.
And then my last one, the reimbursements from Fairbanks, the time study. How is those services when it's reimbursed? How are those funds being used?
So we try to use it some staffing, so benefits, where the AEDs came into it, the health office supplies, all of that is what we're prioritizing with it. It goes back to the nurses and students and the ancillary for, anything that they need that isn't paid out of special education.
And how are the AEDs being reimbursable if they're not being used? How does that work?
It's the purchase, so your invoice. So by purchasing them, anytime that what our system has been, and we started this a few years ago with I believe Erica, we started coding anything that's paid out of Medicaid. We code it with a certain number, so when we go and pull it for that cost report, it's all right there. And that's where we started to improve, because we started like really looking at what could be reimbursed and what we could. And then we just worked with the finance department. We have meetings with them. They go to the Medicaid training with us. We're really all just trying to make it happen where we're not missing anything when we're turning in our reimbursement.
And then the last thing is the CAT. That needs to be changed, because the CAT stands for Cultural Assistant, or the Cultural Assistant Team. We had that years back when we had traditional services. We had a traditional healer. We had, they would go and talk to the students if they needed traditional talking to, or have services like a sweat house, or sweat lodge, or a smudging or anything like that. And we don't have those. We don't have that traditional portion actually as a resource, or as a counselor, or assistant to that. So that needs to be changed, because now everything's in, is it IOC or O? What is this little, IOC. It's ICO. It's all under that, but there is no traditional services. And that used to catch, that was the real big safety net that used to catch the kids who were culturally sensitive. And we don't have that anymore unless they bring it back. But that needs to be changed, because they're not utilizing that.
So past administration wanted to change the name from CAT. We put it on here as reference, but just so you're aware that we still use the same process. We still have the same referral process. It just goes to ICO, and we're short staffed, but we still try to put the cultural relevance into the therapy and we still kept the same process, but yes, you're correct that the name CAT was changed by a previous administrator. Mm-hmm.
So how does that process look then? So if I am a student and I want a traditional ceremony done, and I go to IOC, is that what it's called? I get it confused.
Intercultural community outreach.
Yeah, intercultural outreach department. If I go over there or my parents go over there, what traditional services are they going to tell me? What can they offer me? And who is the one that's the traditional services?
So that's not in my department, and they would have to speak on that. I just know that the referral would go that way. So we still have the referral, the same referral where they would check off what if they wanted the traditional and what they would choose, and then it would go to ICO. But after that, I can't speak for what Rachel or anybody does.
And that last staff that you just named, she used to be the cultural part of the CAT, the cultural part, but she's being used for other regular day stuff. But see, this would be helpful if you guys reconnected with behavioral health, because then if you guys reconnected services through them, they have traditional healers that they could go to at Shiprock. If Shiprock is backed up, they could go to Red Mesa, or even get sent out to Gallup, or they have a list of traditional medicine men who are documented with the Navajo Nation, who then can get services through the chapter house or other services through Navajo Nation to get services paid by a medicine man for whatever ceremony that they're needing. So that's another thing that you guys look at and reconnecting that bridge there. That was because that was in place, but it was taken down when the CAT team was taken down as well.
Yeah. So we do have our MOU with IHS Behavioral and now John Hopkins as well. And so I'm familiar with what you're talking about. So yep. And the good thing is that now those non-clinical, we just started calling them non-clinical because we had to stop calling them CAT, but they'll be able to provide that in Max Capture in their notes. So we'll be able to align better now too.
Oh, I had another question. Sorry.
Miss Jones, this is Dr. Lopez. Can I add just a little bit to that, please?
Yes, you may.
Thank you. Just in support of that, we do receive some referrals from Amanda's department, and we also have a forum that in ICO that was created there with Rachel Brown and Miss Alicia when they were there, and it's online where parents can fill them out, or if they call the office, Rachel does take that information. Although she does do the pantry and does takes as a liaison for parents, she still does serve anything that has to do with the cultural aspect. Counselors, she's made contact with counselors in the building to also call her if there's a need, if a student is needing uh, that service through the cultural lens. And so that is one of the first priorities when there's a student in need and they need her service. So she's still fulfilling that role in ICO. Last year, we only had a few requests from students, but she has been very visible, letting counselor or verbal, should I say, and letting counselors know that ICO is still providing the cultural service through our department. And also, she has been provided a cell phone in case she's out with families and there's an emergency, that they can contact her on that cell phone. I hope that it helps explain a little bit more on that service.
Well, I just think that with Martinez and Yazzie case, I think that we really need, Mr. Carlson, that we really need to have a traditional, have that brought back to the district, whether that's Miss Brown, doing cultural 100%, or because there's a different way of talking and
Yes.
and you can't really rush it, and and finding out about maybe her billing at that time for traditional services as well. But yeah, I understand what she's saying.
Okay, thank you.
Thank you. Oh, my last question.
Are you sure this is the last one?
I think so.
Okay, go ahead.
Miss Sutherland, the expenditure report for 11,000 operational funding. Can you elaborate more on that? Is that just for student support services, or does that include consultants that come into the district for training? And then expenditure 25,153. How that's being utilized, the operational funding.
That's for the Medicaid, right? So again, our ancillary and our social workers, they need to be, anybody that's gonna bill for Medicaid needs to be out of the 11,000 so that we can get the reimbursement for their FTE. So like if we have SLPs in our 24109, then we don't get that same reimbursement for them. So we have to put it all in 11,000 so the district gets it back. And then it goes back into that revenue and that cost report. And then we get Fairbanks also.
What about the consultants that come in and do training for the staff? Are they paid out 11,000 or are they paid out of the 25,153?
It would have to be that particular training. I'd have to see the report, but I mean, you could if it's in the out of professional development or for the nurses, or if we're sending them on training for certain training for health aides and nurses, that gets paid out of there. But we're in our department, we try to, we get funding through IDA, and so we try to help out that way. So like we try to provide the teachers and resources to help with the students, the PD for teachers, principals, even other staff members. We try to, sometimes we all co-sponsor PD. I don't know if I'm answering your question correctly, but there could be, but we try to use the Medicaid for the nurses, and there's a whole list of things that are eligible to be paid through Medicaid. It was just it's like 3 pages but mostly we try to stock the health office. We try to give them the resources that they need to do their job. And that's what we just bring it back and reutilize it.
Okay.
Sorry.
Mr. Montoya, welcome back.
Thank you. Just as a point of reference to the audience, I just came back from the public forum that they're having at the field in regards to the Arizona Energy Commission and Teresa Vicente Aguilar, the commissioner for the PRC in New Mexico. So that's why I was tardy. So I have a question, Ms. Sutherland, if I may.
Go ahead.
I'm sorry, Mr. President, as well, too. Apologize. The individuals that provide the CAT team services, do they collect reimbursements for their services?
Not yet. July, that's what we were just discussing when you walked in, is that after July 1st, they will be able to.
Okay.
Well,
and are those, again, are those bachelor's degree, master's degree, licensed social workers, or what's the actual?
They're bachelor. And so that's why they're called non-clinical. They're at a bachelor level, but they have to be supervised, which we have a supervisor for them. And then somebody just has to sign off on their notes. And so they'll follow the same structure and the same expectations for the max capture, where they have to code their service, put in their notes, and then their supervisor comes through and checks them off, and then we turn them in. They're called a sweep, and then max capture does a sweep and turns it into Medicaid.
So basically all they're doing is evaluations.
No, they can see students in groups, and they can see a student for like 3 times, and then after that they have to refer them on.
The other question again is they're obviously not providing any clinical services though, right?
No, they're not allowed. Correct.
So the other question begs to be asked, and isn't that a little redundant?
Well, the clinical, so if I am understanding your question,
if they're in respects to the services that they're providing, if you had a master licensed social worker who could provide that service rather than going through the process 3 times and then being referred, that's why I'm asking, isn't that a little redundant?
Oh, that's not the, if I'm understanding, so if the non-clinicals can be referred at the school level, and then they can see the students, and then they would be able to bill for that time that they are able to see them. And then they can do group, you just can't do individualized. Our clinical, our higher level of master, they work with the special education students, and they're through the IEP. And when we say referred on, either some students they transition over into an IEP after they've been tested and evaluated, then social work could be added on. We do have students that don't qualify for the clinical social worker, and so they will, on a needs basis, touch base with their non-clinical social work advocate at the school through the referral process. So that's how that's done.
Okay. Thank you.
Mm-hmm.
George, you have another question?
No, I'm fine. Thank you.
Mr. Montoya? Good. Ms. Haskey?
I have no questions. Thank you.
Okay. Sutherland?
Thank you. I think I'm the next report.
Continue.
Okay. So My apologies to board president, board members, superintendent. We were asked to provide information on the parents as teachers, materials, and general supplies and materials expenditure. And again, we don't have access to this, but I did work with Dom Atherty in the finance department, and this is what he sent. And so we have spent a total of $11,409.43 on supplies and materials, and there's actually a list that we have purchased for them. So the Parents as Teachers is a early intervention program. This report right here only shows the supplies and materials. It doesn't show the total salaries and benefits, but we do pay for 1 teacher and 5 EAs that do work with our birth to 3 and 5-year-olds. And they just help with the parents. They have activities with the parents. They just do so much to get the kids ready to enter pre-K and to enter school. I was talking to Miss Atherty, Terry Atherty, the other day, and she was like, you know, she's so proud of her program, and she said that her parents that she works with understands and knows curriculum compared to those parents that aren't involved in the early intervention program. So it's prepping not only students for school, but the parents as well.
I have a question. Is that funding to parents as teachers dropped off in the last while, or is it where has it been and where is it now in comparison?
So I came in 2016, and that was one of Miss Atherty's concerns. Was prior to me there was different funding, and I did do some research back then, and from what I can recollect is that it was funded through Title I, and then somehow, probably through transition and overturn, they didn't fund it, but then they did. There was a gentleman that was over, I believe, this department that went out and got this grant, and we call it the Navajo Nations grant, and that money goes to salary and benefits. And so we have had a decline in funding. We're just kind of barely hanging on now with what we could do. We used to be able to use pre-K money for it, but pre-K got really strict with their guidelines, and so we weren't able to use that anymore. So this budget of the 112,000 that you see there is our budget from Navajo Nation grant. We have in the past, Becky and Terry have gone down to Window Rock and visited with them and tried to increase it, but they won't increase it as well. So we this is our budget.
Oh, what then are they doing, and what are we doing to provide supplies for Pat?
Mm-hmm. So this is the budget that they have now, 13,000, and that's what we're using it for. Is their train? So it's not showed on this, but we also have money that goes towards their certification and their trainings. They're required as a PAT program. So the Parents as Teacher is a national accredited program, and so we have to always budget for the airfare and the training.
Well, I'm concerned because I've heard concern about supplies for Pat being purchased by the staff, uh, which, I mean, my wife was a teacher for 38 years, and I know what that's like. But they hadn't ought to have to be purchasing supplies out of their own pockets.
Another, so we have funding, and we meet with Terry often, and I think, Becky meets with her at least weekly. And we do have a little bit of the funding. Part of the problem has been, and it's the same with some of our other grants that we're during COVID waiting for Navajo Nation to filter through the funding. So the funding comes in late, and then the way our system works, so by the time it comes in April, then the spending has been shut down, and so we have to wait until July to start our new fiscal year. So it's always just a cycle of planning and waiting. So we have purchase orders ready to go, but we have to wait until July.
Well, I understand that. Having worked in the maintenance department, I know what funding is and where it comes from, and sometimes that is delayed. But are there funds available to Pat in the upcoming school year?
This budget right here is what would be available. So we would get our new funds, and then we'd have a new report and then a new budget. So I may not be,
my concern is, are they going to have to wait until next July in order to receive funding for supplies? That,
No, sir. They would. So in July, we'll start our new fiscal year, and then they'll be able to start spending in July on what we just got for the grant, and then they'll be able to start spending again.
Well, from what I heard, they hadn't had many funds to spend, so I guess that's why I asked, where are we at now comparatively to where it has been and where it had been in the past. I know when the program first started, I was in the school district at the time, and there was funds available then. And I'm wondering, compared to that, what funds are available now? That was my question.
Yes, sir. If I'm understanding correctly, it was funded differently in the past, like you're saying back when, and prior to me coming, then that extra funding stopped somehow, and then the grant took over, and so whatever that grant provides is what we're using. We have, we're always able to do a wish list, and so with the district, Donovan's group does a great job of sending out a workbook, and then what do you need? What do you wish for? And so that's always one of our wish lists, is just maybe supplemental to what the grant is needed. And then, we just try to really plan, stay ahead, get our POs ready, and then get going on the spending again.
Perhaps, perhaps you could look in and find out where the money came from before the grants started, before it was being funded by grants, and see what the amounts was, where it came from. Because from what I'm hearing, they've not been able to receive funding for supplies. That's then if they're buying it out of their own pocket, it isn't gee, I wish. There's a need. So perhaps you could find that for us.
Right. And what I meant was for our department to be supplemented, but you're correct. It was funded by Title I, and then for whatever reason that went away. But I can work with Mr. Carlson and maybe the CNI director, and we can figure out like if there's other federal funds that we can use to supplement, or that we'll make sure that they get what they need.
Thank you.
You're welcome.
Anything else?
I got a question.
Of course.
Miss Sutherland, what are the uses that the parents as teachers can use the funding for this through Navajo Nation? Because I know when they have their recruitments, they have to, they buy food, they buy game materials to get the families and the little kids active. And so what are they able to use the money for when they're having their recruitments and then their trainings for the parents as well?
So great question. So as you can see on the expenditure report, that's the material they like to get. I know in the past, talking to Terry, they used to be able to get books out and things, and to the kids, they've been able to do kits, but really they're fortunate because there's not those restrictions for the food. And oh, Becky, I'll let Becky talk. She's waving at me.
There is food restrictions. Navajo Nation grant will not allow us to buy food. We had another grant called the Brindle grant that we used to use to purchase the food that we were doing. That was only like a 2 to 3 year grant, and then they only do short-term grants. So currently we do not have a grant that allows us to buy food, but if we have the funding, we're allowed to buy any type of supplies that they might need, but it's all based upon the amount of funding we have.
Okay, so I guess this question would be to you, Mr. Carlson. And I'm trying to be disrespectful, but just the way it might sound. I'm not being disrespectful, but I'm just
Sure.
But
Don't take offense, in other words.
yeah. So if staff can have food purchased through the schools for staff meetings and parties here at administration, they can get food and have it paid for. What's the difference for paying for PATS food for the district, for our students, for the little babies at their recruitments and stuff?
Well, it sounds like part of that is what Ms. Brandt was referring to is stipulations from the Navajo Nation.
Yeah.
And so I'm not sure that we can get around those.
Well, I understand that part, but what I'm saying is it's separate from Navajo Nation paying for it and it have restrictions. Why doesn't the district pay for the food, pay for that, for the PAT recruitments, or when they have trainings, as we do pay for, like when you guys have meetings or you guys pay for food here for administrators, or in the schools use their budget to pay for staff, staff luncheons, parties, whatever. Why can't the district pay for that like that? From the
Generally
district
speaking-
side.
Yeah, that's a good question. Generally speaking, we don't buy food for the students, even though there's some line items you can buy for staff. And I think that's something that Mr. Yazzie might actually be able to answer a little bit better. If there is a way that we could do that, I'd be all for it. I just think part of that has to do with statutes. Mr. Yazzie, are you listening to the conversation? Would you be able to expand on that a little bit?
Thank you, Mr. Carlson. Good evening, members of the board, Mr. Carlson. And yeah, so to my understanding, just as Becky mentioned, there is grant restrictions. Most of the grants that are have restrictions on food purchases. And so when purchases for food are done, they have to have an agenda tied to it, and also they have to be tied to the school and the district's 90-day ed plan or 90-day dash planner. So all that stuff has to be tied together. So it would have. So if we were able to do this, I would need to look at to see where how the parents as teachers are in alignment with those plans with the school. So that would have to be an departmental communication between the program, the PAT program, and the school to see how they can tie it with those goals. So those details have to be looked into, because when food is being purchased, we have to look at we have to have that information there and available. So those are some of the requirements when purchasing food. It also has to be, and I think student food purchases can be done through the student nutrition food services too as well. So they could collaborate with them and work with that department to get those paid too through that.
I just a question. If we have recruitment, why are we? I mean, I can see providing food for kids in class, but why are we buying food for recruitment? That seems like we're buying food for the parents, not the kids.
No, because the PAT program is different. When they do their recruitments at after school in the evenings, majority after school in the evening times, that's how they get they bring the parents in, they bring the kids in, and they do activities. They have materials like reading events. They have stations that the little kids go to monitor their cognitive, their abilities, and they watch them, and then that's how they refer them if they see that they have some kind of cognitive need or whatever other need that they notice. Then they go to the parent and they say, your child is lacking this, and if you come to our program, we have these services and we have these abilities to work with you through home, or you bring your kids to the school and we work on those. And with that, it's just like any other training that you have here for parents, like at any school. Like, some of them have cookies, some of them have punch, some of them have pizza while they're doing these trainings. That's what I'm talking about. And that's part of the recruitment process, because I've seen it. And it doesn't have to be like a dinner, but just refreshments or, something like that, that while they're doing those trainings, it's there. And that's how they get the family and the kids to get into that program. Because these kids are anywhere from, correct me if I'm wrong, like from, I think it's one to 4. Yeah.
It's birth to 3.
That's why this program is very, very much in need. And you have these kids who, are lacking, they need this service. This is why PAT is really important, because it's from birth to 4 years old before they even start school. So it's very detrimental. And I don't know why we're treating it any different, because we're not following Yazi Martinez, because you have these kids who have a right to learn from birth to 4 years old, but we're putting stipulations here saying, oh, we gotta, this gotta do this. And that's why the PAT program is dwindling down, because they can't reach that population, and they're not able to utilize their funding as needed.
I'll have to rethink this.
And we do need it. And that was a part of the big process about the building in Newcomb, because Pat doesn't have offices besides the one in Kirtland to do their work or work with kids. That's why Pat needed a classroom, or, out at Newcomb, so that they can go out there and serve Newcomb and Nosh Chitty areas with that program from birth to 4. That's why it was so imperative.
Sounds like we're taking them out of the home and institutionalizing them then.
No, it's not. No, it's not like that. It's they get just like maybe a little bit of teachings, and the parents are the ones that are actually there teaching their kids, interacting with their kids, teaching them, whatever cognitive skills that they're doing that day. The parent is there. That's why it's called parent as teachers. The teacher's there simulating, but the parent is interacting with their child. So they're building their relationship with the child. They're building, they're connecting with their kids. They're helping them in the home environment.
So are we teaching parents how to parent? Is that what?
It's some of it, yeah. And then how to just kind of teach your child different alternatives, especially if they have behavioral, or if they, early reading. And
Okay.
Am I correct, Miss Brandt?
May I speak, Mr. Carlson?
Yes, you may, Becky. Thank you.
The PAT program, we have it in all 3 areas. We have one in Newcomb Nosh Chitty, and they do have 2 classrooms in the school currently. We have a program in Shiprock, and they have theirs at Najoni, and the program in Kirtland is at the Kirtland Business Office area. They have 2 different types of programs. They have what's called the Family Connections, and they're once a week, and they vary from which days they're in each areas. And it's usually about a 2-hour time. And the parent educators work with the families to help them learn, some strategies or skills to work with their children. And the parents are always with their kids, and they're interacting with their kids as they do that. And then the second part of the program is a home visiting program. And so they have like up to 20 students that they what they call case manage. And they do home visits with those families, and that's individual one-on-one. So the program, has 2 different components. And what I'd like to say is I'd encourage any of you to go see one of their programs, how it's run, the Family Connections. Not so much the home visits, because they're more personal sometimes, and parents don't want. But I would really encourage you to go see the home visits. Not the home visits, the Family Connections, and see the activities they do with the families. Did that answer your question, Ms. George?
Yeah, thank you.
Are there any other questions?
If I may, just one more.
Okay.
Mr. Carlson, may we use the 11,000 operational fund? Because that one, when Ms. Sutherland gave us the presentation, it had a lot of ability to to be more open with students and with reimbursements and maybe 1,100, maybe 11,000 fund could be used.
So I don't know if I would be able to answer that right now, but I believe Mr. Yazzie might be able to as well. But if we can, we definitely will try. Mr. Yazzie, you want to go ahead and, I know that there's definitely 11,000 has some pretty serious limitations and some specifications as to how that money can be spent.
Yeah, not just only for food, but for perhaps materials or
For
whatever.
materials.
Yeah, because I know, like Mr. Wells said, that they've been paying stuff out of their own pockets, and so just for whatever
If we take the food out of the equation, we can get the materials.
Mhm.
We will.
Okay. Is that all you had, Ms. Sutherland?
I believe so.
Okay.
Thank you so much, everybody.
Thank you.
Have a good night.
Weekend.
Go home, go
Oh
to
yeah,
bed.
have a good weekend.
Thanks.
I guess that leaves you, Mr. Yazzie.
Thank you, President Wells, members of the board, interim Superintendent Carlson. So the first thing that I'm presenting today is a request to update the current authorization list for our Bank of America activity counts. So we do have a letter here that I'm sending out to Ms. Sheila Ramon at the Bank of Southwest, and then also an attachment to this letter are the updated listing of the individuals that are going to be depositing into the account and dropping off night deposits, as well as including Mr. Carlson here to have access to the account and be an account signer. And then the listing of all the names are on page 2 and page 3 of this document. Have any questions regarding
All of these names of people who have access to those accounts, or is that
So-
just dropping off?
So if you look at the thank you, President Wells, members of the board, and our Superintendent Carlson, if you look at the duties of these, they just have the access to deposit information to the account for the principals, pick up night drop boxes or process change orders. So basically this is what they do for the district. And so this is the only information that the bank is allowed to give to these individuals.
Okay. I tried to study that and couldn't make sense of it. Well, now I know. Any questions?
I have a question.
Yes.
Can you explain the process of order? Is that just counting the change and putting it in the money bag and listing all the, like you have 2 quarters and you have 20 50s? Is that what you mean about the change of order?
So a change order, thank you, Secretary. So what the change order is, if you request process change orders, are if you need like smaller bills. So let's just say you need, we'll just give an example of $50. So if you're going to process a change order $50 and you need $50 at once, you can. That's what that is. You exchange a $50 bill for smaller bills. You know, if, in this case, if you want 1s and 5s and quarters, you know, that's what the change order is. You request for bigger bill to receive smaller bills, so you can process change when they are taking funds in during their activities that they do.
Thank you. I have another question. So are we are we still following the process? Anytime there's money in the building, there's money there. Is it still the 24-hour drop that you have to make it to the bank? And if it's not, then it's a comes up as a what's it called? If you don't put it in there, it comes up as bad. I can't remember the word that it's used for, but you have to go through a lot of hoops if it's not deposited in a timely manner. And if all these people have gotten training on the paperwork, because there's an extensive procedure and signing. You have to sign like 3 times, and then you have to count the money, and then you have to have somebody else count it, and then you have to lock the bag, make sure who you hand it off to signs that they put it in the safe, and then you got to count it before. Like for instance, for games, you got to count it before, you got to count it after. So have all these people been trained for that?
Secretary, we do have training at the beginning of the year for the staff. And we do have, that was done at the beginning of the school year. So we are working on the process of that too as well. So we're looking at reviewing that as well. So because that process was put in prior to me being here. And so that's what we're looking at doing. So we have provided training to the staff at the beginning of the year. Those are documented too as well.
So we are still doing that same process then currently?
Correct. Currently, we're still doing that same process.
I remember the word that I was trying to say. It becomes an after the fact if it's not deposited in a timely manner. Within I think it was 24 hours, that the money has to be deposited into the bank from the school. And if it's not, then it's after the fact. And we get, as a school district, we get penalized for that.
Yeah, so that becomes an audit finding.
Yes, exactly.
To the not being in compliance with the 24-hour deposit rule.
Right.
So yes, as far as I know, we are still following the same process that's within the CCSD policies and procedures manual.
But since these new people are new, some of them, they are going to get this training and the procedure that they would give. Like when they go to Sandra Ration, she's got that whole process that they have to follow with the signing off, who got the money, who counted it, and who handed it off to who to put in the safe, and then from the safe to the bank.
And so that's what we are asked for from the auditors. Like, how's the money being transferred from one person to another? We have to count for that money. So that's the rationale for those forms. And so those are also within, again, the Central Consolidated Business Policies and Procedures Manual. And we do have to follow the New Mexico supplement documents too as well. So we have to go in accordance with that.
I would just ask that those new people, all those people listed, get that training.
Absolutely.
Okay.
That
I have a question. I have a question, President Wells.
Yes, go ahead.
In terms of all of this with the deposit, the listing of deposit, where does the armored vehicle come into effect? I thought I saw an expenditure on the budget form for the armored vehicle. So when do you, out of this process, use the armored vehicle?
Vice President Haskell, members of the board, Interim Superintendent Carlson. So the armored vehicle, we have a drop box here at our district, and we have one over at the Newcomb area, and we've been doing our best to get one over at the Knox City area. We've been working with the armored vehicle service to get one completed over there. So the drop box gets, so the deposits get dropped into those drop boxes, and it issues a receipt, and that receipt gets accepted in, and that receipt is what we use to be in compliance with the 24-hour deposit criteria. So that gets taken into account, and then they come in and pick it up from the safe deposit box, and they take it into the bank, and we get a deposit receipt.
Okay, thank you.
Oh, I do have one more question. Do the people listed that you showed, are those people all getting stipends for the gas when they take the money to the bank? They get paid a stipend, a gas and mileage reimbursement. Is that still going to be to all those people listed on there?
Yeah, so that's Secretary. Yes, we are continuing to pay the mileage reimbursement when they turn in those forms.
It should be.
Okay, I have another question. What's the difference between dropping off using the armored vehicle services and then doing this? What's the benefit of having to drive in and get mileage reimbursement if you already have an armored vehicle coming out and picking up those deposits? Why are we doing both? I mean, it sounds like there's a couple of systems. Why are we doing both systems? Thank you.
So the people who are getting mileage reimbursements for dropping off deposits are mainly coming from the Kirtland office, and so what they'll get mileage reimbursements from their site to wherever they have to take the deposit to. So, for example, if they're going to be coming from Kirtland, one of the Kirtland schools to the bank, that's what they request for mileage reimbursements for. So it's not necessarily mileage reimbursement because there's a box there. It depends on it gets authorized by the local administrators to reimburse the mileage when the employees use their own vehicles for district travel. One thing that we are doing and working with the operations department so that we can have district vehicles at each of the sites so that we are able to utilize those vehicles so that employees won't be using their personal vehicles to deposit, make these deposits or any type of business transactions. So that's one thing that we're looking forward to this coming year, and that's what we've been working with the operations department as well too.
I think, Mr. Yazzie, the question centered around drop boxes and armored vehicles rather than are the armored vehicles traveling to places other than Kirtland area like Shiprock or Newcomb, Nash City? Is that for paying for armored vehicle pickup?
The armored vehicles are only traveling to areas like Shiprock, and Newcomb and Nash City.
Correct. That's what I thought. Does that answer your question, Ms. Haskey?
Well, I was asking if I guess okay, so if that's the case, then the Shiprock people are the ones that are running into Farmington to make the deposits, correct?
I think
And
in Kirtland area, is that not right?
or to Kirtland? Because you said Kirtland is the only one that's running in, but there's a whole listing. You have a 2-page listing from all over, from Nash City all the way to Kirtland. That so that's where I was wondering why. You see, go down on the next page. You have a listing. Oh, okay. So most of the people are from just Shiprock and Kirtland. And Oho. Okay, that answers my questions. Thank you.
I have a question.
Okay, go ahead.
So I know with Shiprock, I know that the financial secretaries, they take, or whoever's designated in the school, they take the money down to Wells Fargo and they deposit it in their own personal vehicle, or, they don't usually have a school vehicle to use. That's why they have the mileage reimbursements. And that happens through Newcomb and Noshchitty as well. They come all the way down here to Wells Fargo and deposit the money. If we're using armored vehicles, I think we should utilize that throughout the whole district, because nowadays we have to think about safety. And a lot of these monies that are being transported, it's a big amount. It's not just $50. Sometimes it's over $3,000 that these staff are carrying. And with all the violence going on in the world, we're setting up our staff. We don't have security riding with them in the car. We have to think about safety. And so we have these armored vehicles. They should just pretty much go throughout the district and pick up the money. Change your procedure. Maybe whenever I know you don't want to keep all that money for a long time, but
It has to be deposited within 24 hours.
yeah. So if you're having those armored trucks, just have them sweep the whole. They do it in a day. They do it in the morning, I guess. Right then in the morning, because we're paying double. We're paying the armored vehicle company, and then we're doing reimbursements. And sometimes these financial secretaries or staff who are designated, they're so busy in the school, sometimes they can't make that deposit because they're being pulled here and there, and they just can't make it. And so that becomes an after effect when they were intentionally trying to get it to the bank, but something else came up. They were needed in the school, and they couldn't take it right away as they intended to.
Thank you for that feedback. Again, as I stated, this is my first year here. And so I'm going through and working on some of the policies that have been in place. And so, and that's what I'm doing. I'm reviewing, and it is our efforts to become better so that we can make sure that we meet the needs of the students and that we continue to be in compliance with whatever statutory requirements we have to be in requirement to make. So thank you for the feedback that will be taken into consideration.
Can I ask a question? Do we, how many different banks do we have an account with?
We bank with President Wells, members of the board, Interim Superintendent Carlson. We bank with Bank of Southwest and Wells Fargo Bank.
Okay. Is there a reason why we're banking with two different banks?
I believe it is due to the location of where they're at. You have Wells Fargo here in Shiprock, and then you have Bank of the Southwest there in the Kirtland region.
I see. Okay. That makes sense. Accounts payable, and let's move on to item F.
So moving on to item F, accounts payable disbursements. We have here showing a 196-page report for disbursements from the operational account totaling $3,947,816.29. Do we have any questions relating to the disbursement listing before we move on to the activities listing?
Ms. Hosky, do you have any questions?
This is the 196-page document. The one you have, that's the one. Okay, I did have a whole bunch of questions and I think they were shared with you. I just wanted clarity on the sections that I had highlighted.
Okay, so all the pink highlights, correct?
Yes.
Okay, so I see some highlights on page 41.
Let's see. You can go to 41. Oh, and I was inquiring in regards to those computers, $7 or like $8,000 or $6,000. Is that for one computer? There was that, and there was one I believe for 19 or 18,000. Are those bundles of computer, a couple of computers, or what are we doing with that computer that it's 6,000? And I know there was another one that was um, quite costly too. What are those? Are they specialized computers to do specific things? What is the function? Why are those computers so expensive? It doesn't even come with the software. Well, it does. I think these are just. This is a computer for $6,338.99, and there was others that I highlighted in there. So, oh, and the item 1336 too. Those were my questions in regards to the computers.
So for the Vice President Haskey, members of the board, Interim Superintendent Carlson, so the purchase of the MacBooks for the Human Resource Department. Let me go look really quick. This is the right one. I believe that one is 8,000. That was the purchase of 10 computers.
Yeah, 5.
Okay, that's kind of what I wanted to know. How many books? The way it's written, it looked like it was just one, and we were spending 6, 7, whatever, $8,000 on one computer. Thank you.
And then I think some of the other computers you have highlighted too, they have like for the one that's right here, that one's for computers for the I believe it's the nurses if I remember, and the staff in the student support services department.
But it's multiple computers, correct? Not just one computer?
Yeah, that one's multiple computers there.
Okay, thank you.
I pulled each of these ones up that you highlighted here. And then I think you had stuff highlighted on page 152. So if you look at where it says item 3433, New Mexico Gas Company. This is the utility bills for the district.
No, I think it was further down. Oh, it was 3438. What were these requests, these increases for like 33,000? And then there was one for increase for, see, they're here. There's 3438 and there's 3441, 3442, and there are other increases for $115,000. What are those for?
That's
It
what
doesn't specify.
That's what I'm explaining. That's why I'm going back up to the top. If you go back up to the top of the actual report, and this is what I need. This is what I was talking to our staff right there, where it says New Mexico Gas Company. This is tied to one purchase order. Purchase order, like 22-00029. It's a purchase order for the district's payment to the New Mexico Natural Gas Company. So all of those little lines there are are the bills that were submitted. And so what we do is we submit a purchase order to pay for this utility company for the whole year, and it's based off of a estimated dollar amount that we get on expenses for the whole year. We project that off of totals that we received from prior years, and so we set a dollar amount. So what happened is the expenses for the gas have increased, and so the request was to put in if you go back down to the $33,000 there on the bottom of this, the request was to increase this purchase order an additional 33. This is the one that has 33,000 to cover the remaining expenses for the year.
So are you saying that each of these are going to be $109,000 instead of $70,000? Are they multiple bills or are they just one bill that's written for each line item?
So we get a bill for each of the schools. So if you look at all the itemized listing, there's a bill for each of the different areas that we're charged at. So that's what each of those lines are. And so I do have to talk to my staff about how they put the request in. So where it says the 5/5/2022
Okay.
request to increase probably should say natural gas utilities and service for this area increase requests done on this date instead of having a staff's name there.
Okay, that would be helpful. That would be helpful because it was kind of confusing to see the 33,000 and the 115,000 increases. So that clears up the confusion for me. Thank you.
Right. And that's the case with the other one for the 115. That one was done through the Navajo Tribal Utility Authority. Same thing there.
And then I think the other one was about those special services like the OT, PT, registered nurses, occupational those are OTs. Those services, it had a number, like 2,000, just for example, 2,500. I wanted to know if those were added to the salary that was listed in the description. So if it says $70,000 for the salary, are we adding an additional 2,000 to their salary too?
That
was my question.
On page 191 is an example of what she's talking about. Thank you for the questions. I did converse with Director Sutherland on this too as well. So what they do is they get a bill, and when they receive the bill, they cross-reference it to, like, for example, 5117. There's a person's name on here. This is one of the ones. So each one of these, I think, not on this one, but there's where it says there's an example of a person's name there. So they get a bill, and what they do with that particular person is they take that bill and then they associate it with whatever hourly rate is with them, and that's what you see right there is a total. And to my understanding, that is a bill for that person's work they've done for the district, and so they bill monthly to 2 months for this particular organization, the Stepping Stones Group.
So is this the amount on the side, $4,967? Is that an additional in addition to their pay of 102,000? Or it is, right?
That is.
Is that
So this is paid to the contractor, Stepping Stones Group, and Stepping Stones Group is the one who pays those people that the district contracts to.
So are we contracting at $97,125 dollars, or are they getting a stipend or something to make it 102,102.65, or I guess that's kind of that was where I was looking at the differences. So are we giving is that part of their service, just straight across part of their contract service hours, or are we giving them extra bonuses?
So if we look at the actual, like if I go into the actual where it says services provided to the district will include licensed practical nurses beginning August 2nd, 2021 and ending June 2nd, 2022. So the 100 and what is this? The 90, all of those dollar amounts there, the 97,000, the 4,000, the 90 or 79,000, $83,000, all of those dollar amounts, they created blanket PO so that these people would be paid out of that purchase order. So all of these individual totals are tied to those purchase orders. So they don't get that 79,000 up front. They have to bill us. So they can charge up to each one of those individual amounts there for each person. Does that make sense?
Oh, okay. Yes, yeah. Thank you. I think those were all my questions. Thank you.
Okay, any other questions? You had a question?
No, I figured it out.
You don't have a question?
No.
Okay. Go ahead, Mr. Yali.
Thank you, President Wells. I believe we're moving on to the next item, which is the activities list. It is a 5-page document totaling $54,291.90.
Oh, I don't mean to interrupt you, Mr. Yazzie, but there was one recommendation that I did have on that expenditure. There was a section where there was 5 or 6 POs listed, the number of POs, and then a return, but it didn't specify what POs. If that could be there, if in the description, if those could be specified, it would add clarity to your spreadsheet too. Thank you.
Thank you for the suggestion. Is noted, and that's kind of what I talked to our staff here in the department too as well. So I will get with them and we'll go ahead and prepare to report differently next month.
Thank you. You may.
Okay, so the next thing is the outstanding check listing for our operational account. I believe we're looking at this is the right? Am I saying the right one? Is this the operation? Okay, yes, this is the operational account listing. It is a 5-page document totaling $408,518.40. Our outstanding check listing in our activities account totaling $7,480.08. This is our expenditure report for general funds, 11,000 to 23,000.
I have a question on your, let's see, it's outstanding check. It looks like this just caught my eye as I was going through it. 40116.
Mr. Wells, would that be the operational or activities?
That is
An
I
activities.
don't know, outstanding checks listing. That's all I see it on. It shows down here, this caught my eye, a check to Si Senor for $900. Who are we buying dinner for?
I'm gonna have to look at that individual check item. If you just give me a minute, let's see if I can pull it up really quick.
That's quite a menu.
But we can't do the parents as teachers.
So these are done through the school sites activities account. So this might have been for a particular, let me see what it could be for.
Maybe it was a activity account.
These are done at the local level.
Okay. What do I need to look up here to say activities account? Somebody with more experience on this?
I'm gonna have to look into it. It take me a while. I'm still learning how to navigate through our system here. So I'm a little bit of a dinosaur when it comes to.
That's all right. If you can, that just caught my eye. Were they taking a whole bunch of kids to dinner or athletes or?
So I'm gonna have to go and actually check this. I can see the check, but I'm not able to pull up where this purchase order is coming.
Okay.
Oh, I know where to go now. Hold on a second.
That was my only question. And you can get back with me on it. We don't have to stay here all night for that.
Okay. I'll go ahead and send it to Mr. Carlson to forward.
All right, continue on.
So we have the expenditures for general funds 11,000 to 23,000. For the last month totaling $3,220,811.73. And here's the grant expenditures for funds 24,000, 29,000. And totaling for last month. Hold on, I lost myself really quick. This was for grants. Oh, there it is. 1,942,957.23. And then the expenditures for capital outlay debt service. Totaling $5,927,468.63. This is general revenues for funds 11,000 to 23,000. There's $2,061,951.56. This is revenue for our grants accounts, 24,000, 29,000. And I think Ms. Aspas had a question about 25153. If you go up a couple pages to page 2, it's on whatever dollar amount Amanda presented is. It should be right there on the 25153 dollar amount somewhere. So there's the report that she showed right there with 808 $1,000 there, and all she showed was the itemized list of each one of those. So basically, it breaks it down on the report that Director Sutherland presented earlier this evening. You have the revenues for capital outlay and debt service for the totaling for the month $321,666.40. And you have the Johnson O'Malley check listing for last month, totaling $68,348.56. Title VI checks totaling $270 for last month.
I'll check. Hello.
I'm back. Can you open the door?
Okay.
Gary's on the way.
Gary's on his way.
And you have the budget journal entries balancing at $3,901,237 there.
Okay.
Any questions on the accounts payable disbursement and listings that we just went over?
I just have a comment.
We have a comment.
It's just in regards to that $900 C Senor. I know you said you're going to send it to Mr. Carlson, but if we're able to send or pay $900 at a restaurant, I don't see why we can't fund our little kids in the PAT program. That seems to be a discrepancy. Either way you look at it, we can do one over here, but we can't do one over here. So that doesn't seem across the board.
Sometimes you can't take from one account. I agree we need to be able to find a way to do that, but just because if this is from activities fund, that check fund don't work for someplace else.
Yeah, but I respect, I agree with you. I understand what you're saying. But if we have a line item of, what was the line item? Was 13,000 for Pat. Why can't Pat pay $50 for refreshments or $100 for refreshments or whatever materials that they're needing that the teachers are not buying out of their pocket? I mean, I think that we should have a report from Terry at City, because she's the program, she runs the program. And, you know, Mr. Carlson, I think we really need to have people who are overseeing these positions really present to us, because they're the ones that really know. And it's good to hear from directors and coordinators, but it's also really good to hear from the people who are actually doing the work, the bottom inside staff, because they really know the ins and outs of what's going on. They know if something is being followed, if something is not being followed. And I think that's by hearing from, you know, let's just say a department. So if you have the people who are holding up the department, and they're knowledgeable, very knowledgeable. You know, I think if something is not brought to the attention of the department when they're giving reports, I think that not in a penalizing way or not in a disrespectful manner to supervisor or their director, but just looking out for the best interests of the district, I think that they should be able to say, hey, this is what I've done and this is what I see, and we shouldn't be doing this and we shouldn't be doing that. We should be, doing another alternative. And that's what I recommend to you. And then the overseeing supervisor or the director could be like, okay, I take that into an accountability because I don't really know the process. I'm still learning, and I will take your judgment because you've been here longer or you know the process. There's got to be a working connection there because I don't think it should, the staff in the departments underneath should be penalized for speaking up and just being in the best interest of the district. And then those people who are running the programs, I would like to have them report, because then we don't get, I'll have to check this later, or, I don't have that information on hand, or,
If you let us know specific programs, we can have them report at board meetings, work sessions. It might be a rough time now because some folks are already off contract, but we can absolutely do that.
Yeah,
So that's
like the
Sure.
this coming school year,
Let's do that. Absolutely.
yeah, like Miss Terriat City could have gave her report, and, just
That would absolutely help.
Yeah.
Thank you.
I have a question.
Go ahead.
In regards to that, the snacks and so forth that Secretary George is referring to, will we be able to use a small, can we set aside a small pot of funds from Impact Aid to help with those costs? Or can we seek a grant that deals with early childhood that we could find to help with the snacks, the food?
Is Impact Aid only for capital outlay?
Discretionary funding.
Mm-mm.
There are other things it can be used for. Okay.
Pretty much anything but alcohol.
Where are we at?
We are in item F. Biagi.
You brought up Impact Aid. So did, may I ask a question?
Yes, you may.
So Impact Aid was brought up, Mr. Yazzie. I realize that we don't get the full amount. I realize that, and but my question is what we're supposed to get. Did we get 100% of it?
Good evening. Thank you, Secretary I'm sorry, my apologies. Board Member Aspis for the question, members of the board, Interim Superintendent Carlson. So currently we receive Impact Aid, we receive $15 million and $12 million. So that's 55. Is that $27 million currently for this year? And so we haven't, to my understanding, we haven't got the first the amount that's due to us. So we did receive the one for this year, I believe.
Maybe I should rephrase it and say it this way. Okay. During our conference up in Albuquerque, there was talks from another board, I won't say, but during our board association, and it was said that PED kept some of that money of their Impact Aid. And I'm wondering, is that the case with us?
Secretary asked us, to my understanding, from the beginning of the school year, we weren't paid impact aid. We had to contact the Department of Education to disperse our funds to us. So since then, April 1st, I just pulled it up, we got $15,189,811 on April 1st, and then April 20th, we got $12 million for this 2020 school year. So it wasn't, I don't believe it was PED that was holding this year's funds. It was being held up at the Department of Education level. And that's where the money's dispersed from. It comes from them, then it goes to us. So there was a holdup, but I think there was still litigation in Congress at that level, if I remember correctly. And so that was what they were holding up this year. That's to my understanding. I don't know about what happened with the I believe there's still some funds that's due to the district. I don't know about what's happening with that particular fund right now.
Yeah, I'm trying to be careful here too, and asking that question, and but I'm pretty sure it was impact aid, and some of it was withheld, and so and I'm wondering how do you look into that, Superintendent, to find out if these are
People are receiving their money, is that what?
Yeah, we can definitely check on that. and see
Yeah,
exactly where we are.
well, see, I understand it comes in at certain times. It's not a one lump sum. I understand that. Okay, but and I think had I not heard this conversation over there, I wouldn't be asking. But I think it's I think what was said is legitimate, and I'm wondering about ours.
There's questions about the disbursement. Is what you get. I know.
I'm not. I just heard some
No,
of
I
it.
know that's kind of where it's coming from. Is that so? I think, and what he was saying in respects to finding out along with Ms. Chappelle, because I know she's intimately involved in those, or has been intimately involved with, especially the one that's still due, and then one that you're talking about, possibly, and being careful on how that is distributed. I should say that Superintendent and Ms. Chappelle probably look at that and start questioning, because I've heard the same thing. So I know what you're talking about. I think we just leave it to these two to look into it along with position.
Yeah, and so I and to me, I think because we know how that's paid out, and then it could easily be hidden or not well. I don't want to say on our side would be
If we let it slide, we may lose it. We may end up.
right. I mean, I it's just something that could be easily overlooked and not questioned. And I want to know if we are getting that
Full disbursement.
yes.
Yeah, because technically it's supposed to go straight into the LEA, but it doesn't.
No, it flows to the state, then it takes time.
Yeah. Again, technically, per the language of the federal government, it's supposed to go directly to the LEA. But
Yeah. So anyway, that I want to throw that in.
Okay. See, Mr. Got it.
Thank you, Board President, members of the board, Interim Superintendent Carlson. So moving on to budget adjustments requests. So we have here a transfer bar for Fund 24109 preschool. We transferred monies from one account to the other to help with paying for student travel.
Question.
Yes, Ms. Asher.
So now with this bar adjustment, wasn't there not too long ago in order to deal with the fuel costs, was the money taken out of each district's transportation to deal with that?
Secretary Aspis, members of the board, Interim Superintendent Carlson. So we did get, I believe I presented that at the last board meeting, a increased bar from an award that we got from the Department of Education for the extra fuel costs. If I remember, there was, and I could be incorrect when I say this, it was about $300,000. And so that was presented, and so that's and it was put into the transportation fund, so they're able to access that for the fuel.
Okay, what I'm talking about is the state itself. There was some type of legislative action about, and I think I read it. Chappelle, did you?
Yes, ma'am. Oh, can you hear me?
Yes.
Okay. Let me get off.
Are you aware of what I'm talking about?
With respect to impact aid?
No. About the transportation, we're seeing a bar adjustment request here, and I'm asking about that legislative action that happened to deal with fuel costs, and there was something like 700 taken. Where was it taken from exactly? The way I read it was from each transportation department. Am I reading that wrong, or is that the state's transportation department?
So I just want to make sure, board members and board member Aspis, that I'm understanding your question. There was some language in House Bill 2 that gave us a kind of a safe harbor. We had extremely high transportation costs during COVID. It was actually also discussed today during the LFC meeting regarding high costs for obviously increase in gas. I don't recall anything from a statewide transportation department. So I would need to probably hear a little bit more about the concern so that I could analyze it better, if that makes sense. It isn't something I've looked at before.
Yeah, I read it in the that Belzano.
Yeah. Oh, okay.
And
So you're referring to the PED that set aside 2.7 million for emergency transportation funds, and how that's being distributed is based on the miles driven divided by the average of 8 miles per gallon used by most school vehicles. That's how they'll do it. The price of gallon of gas, it says, gone up 82. And so the emergency funding must be spent by June 30th. So that's the one you're talking about.
So
2.7 million.
Are we taking advantage of that in this transportation? Mr. Yazzie?
So Secretary Aspis, members of the board, interim Superintendent Carlson. So this really is just a transfer from one. This is for preschool transportation. So I would actually have to go and look at this particular fund to check to see where it's coming out of. So if I look at this right here, when it says transportation, where it says student travel, so you're taking money out of the transportation fund here, and then it's being transferred over into a student travel account, so it can pay for like if I looked at this, for example, it's going in from one function, student transportation is going into instruction. So basically, we're adjusting the instruction to help offset for this year. We're taking away from transportation to pay for instructional services.
Mr. Yazzie, just so I can clarify, are you saying this is just an internal transaction?
Yes, it's just internal transaction. So this is funds budgeted for this particular fund. This is different from the actual transportation that I believe we're talking about.
I'm still calling you secretary. My apologies. Board member Aspis and board members, I think what we would need to do is research with Mr. Yazzie whether we have taken advantage of the funds, the emergency funds. It was discussed in today's LFC meeting, and if I can be helpful in that, I stand ready to do so.
So the way I understand this, Mr. Yazzie, and I wish I had flagged it, I guess I didn't. But the way I understand bars are rob Peter to pay Paul type of method. And so if we're doing that, then how come we're not taking advantage of that, what Cheryl had just talked about?
So
That's my question, Mr. Carlson.
Okay.
And if I get more information, I'll share it with you, Jermaine.
Okay.
And Carlson.
Please
So-
do, yes. Is it the one that's?
I'm not sure,
Yeah,
but
it is.
I think
2.7
so.
million.
It sounds
I'll also look at that email you're talking about, Ms. Aspis, and circle back with Mr. Carlson and Mr. Yazzie.
I have a question real quick.
Yes, ma'am.
So correct me if I'm wrong. So we're transferring from transportation to curriculum and instruction. Is that where the transfer is going?
It's going from it's going into the preschool account here. It says preschool.
Oh, okay, for the little babies. Okay.
Which date is it? Is it June 12th?
Let me see. I think so. It's just recent.
So the next one we have is a budget adjustment request. It is an increased bar for Fund 27149. Pre-K was awarded additional funds. It's a modification to the grant award for an additional $2,043.
May 11th.
We have here a budget adjustment request for it's to initialize a budget for Fund 28211. It's the COVID testing program. The district was awarded $219,070 from the New Mexico Department of Health to aid with the mitigation and prevention of COVID, through testing and screening of the staff. The next one we have is an increase bar for Fund 29102. From OS for the period of December to May 2016. Any questions?
Yes, so this is for Carlson. Not a question, but more as we are looking at the project out at Newcomb. And that's what's really been on my mind, is to search for that extra money. And so it would be important to find out more of what were these extra funding that is coming in, the extra help, if that's if we can use that so that we can free up some money, you know, and you know, even if we don't use it towards that, you know, it could go other places and still take advantage of that help. So that's where I'm coming from.
Okay, no, I appreciate that.
Proceed.
Thank you, President Wells, members of the board. I believe that concludes the items that I'm presenting tonight.
Yeah, Mr. Wells.
You may.
Mr. Yazzie, can you go back and just go over that COVID one real quick again, please?
Thank you, Secretary. I'm probably going to ask Ms. Amanda for help with this. I do know the district has requested for funds from the Department of Health for the COVID screening and testing of students. So this is something that we just got awarded this recently. And so as far as the program goes relating to this, our information, all we're doing is submitting for the initial budget here and requesting for budget authority for this particular fund here.
Oh, okay, I understand. Thank you.
Are there any other questions from Mr. Yazzie?
Yes. So I have a paper here from Gallup Independent, and I'm gonna leave it with you, Carlson. But on the front page here, it says no amount of money enough for extended school year. Our neighboring district is going through this, and I'm wondering what their concerns are. And it just caught my eye, so I'm wondering, have you heard anything?
Sure, yeah, I can speak to that a little bit. Matter of fact, I was at a meeting with this gentleman this morning in Gallup, and we're presenting to the Legislative Finance Committee, and I'd be happy to kind of share what we shared with them with you all, either in a meeting or I can send them a PowerPoint and talk about the discussions that we had. That was actually something that I brought up because I feel like the way that the Public Education Department has put out the extra money for this extended learning is pitting communities against staff in districts in a way that is unnecessary, because it's not given as here, this is put forth as something we're all going to do. They're putting out the money and saying, if you want to take it, you have to do, these are the stipulations, here are things you have to do. And it's, I mean, it unfolded right here for us in similar fashion than it unfolded in a lot of districts throughout the state. Some districts have been through it a little bit longer, and some districts just said, like there was I reference Aztec because I've talked to the superintendent from Aztec, the superintendent from Bloomfield, the superintendent from Farmington. Some of those districts have programs they can use where they don't need to use that money. And so they just said, you know what, kind of like you've had some community members who said, and that's why,
Mhm.
you know, I'm more than willing this next fall to begin the process of setting the calendar earlier. But I would like for the state to step in and not put people against each other. Because yes, teachers would like to make a little bit more money, some would, not all. But there's a lot of communities, just like some of our communities, who do not want to go to school all summer long. They don't want to get out.
Mhm.
And so now that we have those calendars, that's kind of where this is coming from.
Mhm.
And I didn't know this was in the front page of the paper today because I was sitting right next to him today. And we were talking about this exact same thing with the state of New Mexico. But it's not necessarily a fight, but it's a difficult argument because the state of New Mexico wants extended learning time for our kids. And so they're trying to push that in whatever way they can. But they also, enough of them say there should be local control. So we don't want to just push it throughout the state. We want local school boards to say, this is what we want to do in local districts. This is what we want to do. It's a tough fight, and there's no easy answers. And you know, I'm wondering what's going to happen this next legislative session, which is longer next year. Are they going to change this funding? The ideas that they've had of saying, because it started out with K5 plus, actually started out with K3 plus and K5 plus, then the ELTP program, K12 plus, and now there's a K12 planning grant. So there's all these different ways. The state of New Mexico has more money right now than they've had in a long time. And they're funding education, but they're doing it in such a way that they are trying to allow local control to happen. And so it's a difficult situation. I'm glad you sent this to me, but yeah, we talked a lot about this today.
And to me, it seems too that with all that discussion of the K5 and extended learning and the way that it's presented is you oversee the funding and but in the past it's been where all the strings attached to it and you may not meet one day that person is there to only get a snapshot of what's happening and then they say you're not going to get reimbursed. So the way I understood it was that was the big concern, but now it seems like, I mean, we talk about anti-donation, so I'll just throw that out there. Thank you.
You're welcome. I mean, like I said, I can talk more about it. It's interesting. Mr. Hyatt brought up a solution that actually maintains local control, but does allow for a little bit extra learning time. And he said, why don't we just set it at this number of hours and then let the local school districts and school boards make those decisions how it might look and make that uniform across the state rather than say, because we went through that whole thing and I agreed with all the points that were made, the long school days, not working out great, going through the summer, people don't want to do that. Yeah, all that stuff. So, but it's a conversation that's going to continue throughout the state. I guarantee it for the at least next school year and maybe beyond.
Okay.
Thank you, Mr. Yazzie. H, Open Meetings Act resolution and work session, regular school board meeting schedule for school year 22 and 23.
Good evening, board members. My portion of this is the Open Meetings Act resolution, and I stand ready to discuss that whenever you would like, or you guys could discuss the schedule first also.
If you're doing this, then go for it.
Okay, thank you, President Wells. Board members, as required by the Open Meetings Act, the board reviews and decides on potential amendments to the Open Meetings Act annually. just by way of reminder, the last couple of years, the board has opted to provide language regarding the need for virtual meetings during open meetings, given COVID scenarios. And so, as you can see, and Sharon, Ms. Ray, do you by chance have the red line version I sent you that we could put up? If not, I can put it up. It might make it a little easier.
I'm gonna have to get into my email to look at it.
That's okay.
Okay.
If you let me share, I can share it right now.
Okay.
It says I still need permission from you, Ms. Ray.
Yes, I did.
Oh,
try it again.
Okay. Oh, there we go. Thank you. Here it is. Okay. Let me know when you can see the red line version and if it's large enough.
Might be looking at a blurry.
Sorry, I didn't hear you.
Just blurry.
My eyes are not that good.
Do I need to make it larger?
Yes.
Is that better?
More.
How about that? More?
One more.
3 more.
Okay. I don't think I can go much more than that based on my screen. So what you see in the third whereas paragraph is the paragraph that we had previously discussed, the need for flexibility with respect to COVID and potentially live streaming our public meetings and closing them to in-person participation. So what I've done here, and I can read this to you as well, is because the state of New Mexico has lifted the mask mandate and social gathering restrictions. I'm sorry, yes, sir. What was that?
Can you read it in English?
Oh, yes, I will.
Not all lawyers.
I am so sorry. Okay, I will start over with more English. Recall that the governor lifted the mask mandate and social gathering restrictions, and we had a conversation about the fact that the Navajo Nation's mask and social distancing order is still in place. Its health order is still in place. And based on the language in our leases, where doing so doesn't conflict with state law, we agreed in our land leases to follow Navajo Nation law. And so what this paragraph does, and I'll read it to you here in a few minutes, is it creates that balance so that when we have meetings off of the Navajo Nation, we follow the state's standard. And when we have it on the Navajo Nation, we follow the Navajo Nation health order. At the bottom of the paragraph, given that COVID numbers are still fluctuating and potentially the state could go back into social gathering restrictions or mask mandate, I've left some flexibility in there to allow the board to modify how it conducts public meetings to match what's happening with COVID. So with that explanation, are you ready for me to read the language, or do you have questions with the explanation?
Go ahead.
Okay, thank you, sir. So the new language would read, whereas the mask mandate and social gathering restrictions have been lifted by the governor of the state of New Mexico. However, due to ongoing concerns regarding COVID-19 infections in and near the Navajo Nation, mask and social distancing orders implemented by Navajo Nation President Jonathan Nez and Vice President Myron Leiser remain in effect. Therefore, public meetings conducted by the board outside the boundaries of the Navajo Nation will resume with in-person public meetings. The district will also continue to live stream the board's public meetings conducted outside of the Navajo Nation to accommodate those persons who may be reluctant to resume attending meetings in person. In acknowledgement of the government-to-government relationship with the Navajo Nation and the guidelines issued by the State Attorney General, for as long as the Navajo Nation's public health order remains in place, public meetings conducted by the board on the Navajo Nation will continue to comply with the provisions of guidance issued by the State Attorney General and the Navajo Nation Health Order. As such, public meetings held on the reservation will be closed to in-person public participation, and the district will also continue to live stream these public meetings as it has done during COVID. Given the fluctuating status of COVID-19 pandemic, the board retains the ability and flexibility to continue implementing social distancing practices during its public meetings as it deems necessary. I'm ready to stand for questions on that paragraph.
Comprehensive to me.
On which paragraph?
The third whereas paragraph, the one that I just read, board member Aspis.
As you were going through the purple highlighted, is it purple or blue? As you were going over that, you mentioned about due to the land lease that we were following. Tribal. And so I guess with that, I'm wondering, is OMA even recognized?
Board member Aspis, if I understand your question correctly, I think you're asking if we have meetings on the Navajo Nation, do we still have to comply with OMA? And the answer to that is, my analysis would be yes, we do. As a state school, we still would have to comply with OMA. And where complying with Navajo Nation.
Which goes first, the land or the building?
If you would like me to put the lease language in here, I'm happy to do that. I don't think it's necessary, but if that makes it more clear, I'm happy to do that.
I'm just throwing that out there.
Okay.
But to me, it sounds good. And, bringing up the meetings, I thought, to kind of even out that we were going to have our work sessions in Kirtland and our regular meetings here, or vice versa.
So, vice versa is what it's set up.
Oh, okay. So
that is addressed lower down in this resolution.
Yeah,
okay.
we're scheduled that way.
Okay.
Would you like me to move from this piece?
Yes.
Okay. The next place, just to make it clear, I added in the now therefore be it resolved, paragraph 2, since we referenced the Navajo Nation Health Order up above, just to be thorough and obviously because we're recognizing that health order, I included it in the ordering section. So just to remind you guys, the whereas clauses are kind of like the introduction and the background. And once we say now therefore be it resolved, that's what the board is actually deciding on and ordering. And so that's why I thought it was important to make sure we included the Navajo Nation health order in paragraph 2. And would you like me to read paragraph 2, or is that
Well,
sufficient?
if you'll hold it still, I can read it.
Oh, sorry. sorry.
So in this resolution here, as we're going through it, are we setting through this resolution? Are we putting out to the public what our intentions are? Is
Yes.
that what we're doing?
Yes, ma'am. Board member Aspas and board members. The
Okay.
Open Meetings Act requires us to do that. Yes, ma'am.
Okay, so in the case of what happened Monday, where we had a not special, board retreat. Okay, and that being in Kirtland, do we? I don't know amongst the board members. If it's held there in Kirtland, our board retreat, or if it's held here in obviously we can't have in person, but there in Kirtland, we allow the public or in person to happen. So can we say that we don't have YouTube or
But I don't know. And
video?
My impression was that the reason you have a retreat is that you don't allow for public.
Yeah, not specifically for board retreat. I mean, I'm saying for a meeting. If we have in person, like.
Do we have to have YouTube that you're saying?
I mean, are we? I mean, it's up to the board.
From what I've heard in the law conference, the suggestion was to continue live streaming.
Okay.
That was the suggestion. And I alluded to that as well as continuation of.
Yeah, because we get things set up here, because it's closed. It's a, closed meeting here on the reservation. And so therefore we live stream, through YouTube. And then to set up over there is like, and then we have that delay. I don't know, I'm just throwing that out there. If we have in person, then people are allowed to.
Still, it says right there, the district will also continue to live stream the board's public meetings conducted outside of the Navajo Nation to accommodate those who may be reluctant. And again, from the question came up at the law conference, and it was stated that it would highly suggest to continue doing it.
Okay.
So that answers that right there.
Yeah. Well, I read that, but I was just wondering, what is that still something that we want to do?
There's no reason not to. And I gave the example. I gave the example of how on a couple of occasions we've had anywhere from 500 to almost 800 participants on live stream versus 20 people in the room. So if people are accessing it and watching it, we might as well continue to do that. And that's what that speaks to.
When did we have 500?
There was one day where it was almost 800. It was over close to 780 something.
Wow.
Really?
Yeah.
Having it over there, And having it broadcast from there allows those to participate that don't feel comfortable coming, but those who want to say something to the board can, because if they're video, then they have no, they can't make a comment.
So the recourse is submitting the public comment online.
Okay, I'm just throwing that out there, wondering. Mainly because it seems like it takes a while for us to get going, at the start of the meetings.
So tell Jared to start earlier.
To push the start button.
Move his equipment earlier.
I have a comment.
Okay.
So it stated April 5th, 2022, that the restrictions on Navajo Nation is 75 capacity from 50%. And the businesses that are on Navajo Nation, they must submit a plan to the tribe's Division of Economic Development before they can implement the new limit. And like the tribal casinos, the restaurants, are, campgrounds, and all museums are open, and it's open to 25 people to gather in person and to have training events. And schools also have the capacity to have 50% max capacity, and then of course more for outside. So since April 5th, I think a letter needs to be written with a plan to the tribe's Division of Economic Development so we can open it up here as stated.
You have to do the math for the size of that room. If you open it, see how many people you're going to get in there. Because the max capacity isn't very much. You start counting bodies that board and the directors, you're 3/4 of the people that you have in that room.
And the only other thing that I have about the virtual is, I would like to see where the community can post their comments and it will be seen. And I know on Facebook it stayed a while, but I think on the other one it goes away. After this? It stays? It stays. Oh, okay. Oh, okay. Well, never mind then. Thank you.
Given the comment from Secretary George, what I would recommend, I've highlighted a sentence there. I think it's probably better then to take that sentence out and just leave that the district will comply with the provisions of the Navajo Nation Health Order. Then that gives you more flexibility to follow through with what Ms. George just indicated.
Okay, say that again.
Okay, so in this paragraph, we indicate that given the higher concern on Navajo Nation with respect to COVID, we want to, as a board district, comply with the Navajo Nation Health Order. However, as Secretary George just indicated, the health order has been amended, and I'm glad you brought that to our attention, Secretary George, because I was not aware of that. So the next sentence would then be obsolete or not necessary. If the health order has changed, that sentence would need to be taken out, because it sounds to me from what Secretary George just said, we wouldn't need to close our meetings to in-person public participation.
Limited capacity. It's still restricted.
Right. So that's why you would leave the sentence before that indicating will comply with the the Navajo Nation Health Order.
As long as the meetings are on the Navajo Nation, right?
Yeah, yes, sir. So my recommendation is to take that sentence that's highlighted out.
Yes. Are the chapters in person now?
Yeah, limited, yeah. Yeah, they have people in there. And they have trainings and everything. They have trainings and everything going on.
Yeah, that makes sense. Delete it.
Okay. There are a couple changes that Miss Ray, I think, included in here, and I wanna here in paragraph 1 is the language that you all have been talking about regarding having meetings in Kirtland for the work sessions. Oh, sorry, I got that backwards. Work sessions are held in the district administration boardroom in Shiprock, and regular meetings are held either in the Shiprock or Kirtland boardroom. So that was the language, Ms. Aspis, board member Aspis, that you were talking about earlier. And I just wanted to show you where it is in this new resolution. And if it's helpful, I can read that to you if it's hard to see.
If I get close enough, I can see it.
Okay.
Better than me, so.
Aside from that, the only other change is in number 6, if you're ready for me to move to that.
Are you all ready? Go for it.
Okay. In paragraph 6, we had language in here, and you'll see it off to the right in the margin. And that language indicated that not only would be posted on our district website, but we would also send it to a newspaper of general circulation in the district, as well as posting notices in the district administration complex in Shiprock. So we aren't actually required by the OMA to provide this to the newspaper. We only have to do that now if newspapers request us to do that. And so my understanding from Ms. Ray, and we can have Ms. Ray speak to this as well, is that we haven't been doing that in the district. Ms. Ray, do you remember for how long we haven't been doing that?
It's been a while now, so yeah, we haven't used it.
So Ms. Ray brought that to my attention, and what I would recommend, obviously, is that we don't have something in our resolution that we aren't doing and aren't required to do.
That makes sense. I think that we had not have in there that we will send it to them if they request it and give it to them.
Yes, sir. That's the next sentence, and I can read that for you. It indicates the public information officer and custodian of records shall also mail and or email copies of the written notice to those broadcast stations licensed by the Federal Communications Commission and newspapers of general circulation that have made a written request for notice of public meetings.
I think that's good. I don't think we ought to be sending them without their request.
And one quick question, Ms. Ray, and do we post notices in our district administration complex physically?
We have been posting them on our district website as well as our Facebook.
Okay, but not physically, like on a poster board or something.
I used to, but I will continue to do that if I need to, if that's requested by the board.
I don't, the OMA doesn't require that. And I think that, that language was there prior to us becoming more electronically savvy and posting things on digital media. So it is up to the discretion of the board to either keep that language or take it out. And so the language I'm now talking about is this language, this phrase, as well as posting notices in the district administration complex in Shiprock.
I have also been emailing the administrators and the school secretaries and to have them posted in their buildings.
And that's a good addition, Ms. Ray. If the board would like, we can put that language in paragraph 6.
Yeah, I don't think we need to post it outside anywhere. Are you all good with that?
Just keep doing it. People go by there and see it. Look at it, look for it.
We haven't done it for how long?
They've been doing it for a while.
Do what?
I said they've been doing it for a while.
But Sharon said that she hadn't been doing it for a month. She did it before, but she.
Tree, I guess.
Yeah.
Mr. Montoya, I apologize, but I didn't hear what you said. I apologize.
I didn't say anything.
Okay. Yes, ma'am.
The meetings, is there a way that, see, I wasn't even aware that they post it here. I didn't know that. And other than the website and then now more Facebook. But what about at our high schools and
That was catching.
As far as announcing the meeting, maybe a day before.
Board member asked us. I have been emailing the principals and the secretaries, and I email them their agendas for like 72 hours ahead before the meeting, so they can post that in their buildings if they wish to do so.
I mean, not necessarily for staff. I'm looking more for the public. And if they see those, not everyone has Facebook or a laptop to get onto the website. So I'm wondering within the communities, Kirtland, here, Shiprock, and Newcomb, and the way I see that done is through the high schools electronic, their board, if they could announce the meeting and Kirtland.
You mean like the
Kiosk.
Oh, I can't think of the name.
No, I don't know what
The marquee, the kiosk.
Yeah.
I know in the past we used to email the agendas to the chapter houses. I think at the time Roberta was emailing them. I'm not sure if that's being still continued.
Jared.
President Wells, and we have been messaging chapter houses of our press releases. We have been pursuing those duties. So.
Okay.
Yeah, I mean, lately at one time they had in person, at some of the chapter houses, and then they went back to Zoom. Mm-hmm. And so a lot of them, they don't get the information, even, from like the cultural department, even that, they weren't getting info on that. So I'm wondering if we could, we have those boards for a reason other than games and when school's out, or we could announce the meetings.
How many marquees are there in the district?
I think Kirtland Middle School has one. Kirtland does.
The high school.
Does Judy
Are they-
Nelson?
Yes.
So there, and
Did
then
Shiprock have one?
Shiprock has one at the high school, and I think that's it.
Newcomb doesn't have one.
Newcomb has one. And I think it's just that one too. And the field. What about Mesa and
Rep has one.
just really on that side? I'm wondering why the administrative offices don't have one.
We need one. I think that's in the works. That's a possible plan. So
Can we put in there letting like the rate on for Navajo Nation, like letting the Navajo KTNN know, because that's where it's in Navajo and it reaches all the elderly and people here on the reservation. Just a thought.
So my recommendation for the resolution is that you keep what's required by the OMA, the Open Meetings Act, in the resolution, but things that we do kind of over and above those requirements, my recommendation is not to put them in the resolution, but maybe to have a separate process or procedure for doing that. Because once you put it in the OMA policy, if for some reason it doesn't happen, it then could become a problem.
Right.
Yeah, let's leave it out. I agree.
But I don't want to stay stuck to say the state's language either, because our community is not the same as Albuquerque or a more urban place. So there's other ways that we have to so if we can state it to be open to other ideas, I think that would, but not what would be the language, not
Not to bind us.
not to what?
Bind us to.
Yeah, not to
tie us to their.
It may or may, be advertised or.
If you allude to it, you're going to be tied by it. If you don't and you do it,
then you're on your own. That's right. Good or not.
Absolutely.
Yeah.
because
We can still do it even.
we have surveys and things like that in employment. And I mean, if one wanted to, they could compare all those ways that they do those different topics and then throw in our announcement of our meetings, and there you go.
But we don't have to, we'll have to put it in the resolution that we're not bound by it.
Yeah, that's why I'm talking to her and telling her to word it in a way that it'd be up to us on how we see. I mean, say we get an important issue that comes up, COVID. At that time we had nothing. And I don't think we kept to what we had in our present resolution, but we did it. So
Leave it out and just do it. Isn't that what you're saying?
I think there's in some cases that we need to go above and beyond, but then there's some that we
I agree, but if we put it in there, then we're bound by it.
I don't think we're bound by it.
So I have drafted some language, board members, let me see what you think, that I think balances that. At the board's discretion is the magic language. That means you don't have to do it, but you can do it if you decide you want to. So that would read, at the board's discretion, additional notice can be provided to community stakeholders like chapter houses, schools, and other locations and entities by either electronic, telephonic, or physical posting means. The reason I included telephonic is because sometimes we do use robocalls to get information out. Electronic would include email and text, Facebook, and then of course physical posting would mean we actually posted it at the site.
Yeah, I think if one wanted to take us to court, they already have the evidence against us. So I think this, it doesn't tie us to it. It leaves it to what we feel.
Discretion, yeah.
Anyways, get that marquee going.
It's going. I was just looking at the plan, and that is, it's not before this next school year, but during this next school year, it's one of the things that should be started. Marquee and signage. So,
And instead of posting that TV in there, what's it for? That big screen.
Yeah, it's true.
We could have it right there and where somebody could walk up and see, you know, the
Where is this?
announcement
Where is this at?
in that front lobby, that front room.
With that, board members, would you like me to read the entire resolution? Or is having it up on the screen sufficient?
No, this is fine.
I did, since you guys were talking about marquee, I did put marquee in there in that sentence as well.
As long as you got at the board's discretion.
Yes, sir, that's at the very beginning of that sentence.
it's important word.
Okay, can we move on?
Yes, sir. Thank you, board members. Sharon, Ms. Ray, do I just need to click out of here for it to go back to you?
Just not lose it like we did one time.
I think I got it. Let me check here.
Okay.
Nope. Leave it disabled. Okay, I got it. Thank you.
Yes, ma'am. Thank you.
Had an eyelash out of place.
Board members, I apologize. I meant to say this earlier. With regard to the impact aid discussion, there are some ongoing issues that I would recommend be discussed in executive session because that conversation does involve an open matter of litigation with the Federal Public Education Department. But we do have information to share with you on that and some status that I believe would answer the questions you raised, board member Aspas.
So can we do that Tuesday?
Happy to do that. Yes, ma'am.
Coming up number 5.
I'm sorry, what was that, Mr. Carlson?
No, I was just saying, yeah, we can absolutely do that. We're getting ready to do number 5 after number 4. So,
okay.
I have a question. She already closed it out, but I was trying to let her let everybody talk. I just have a question. So in that paragraph, it said stakeholders would be, made aware by telephone, all that you listed on there. Is it, can we add the radio advertisement?
Sure.
Because if we're talking about how you stated it, then I think that
Thank you. I should have thought of that. Thank you, Secretary George. I have added that. If you all would like me to add that, I can add that.
Go for it.
Okay.
Thank you.
Yes, ma'am.
Anything else for Ms. Chappelle?
No.
Thank you, board members. It was good to see you.
Thank you,
You
Jermaine.
too. Have a good night.
You too. Thank you. Bye-bye.
Bye.
You don't need me to stick around anymore, right? Just clarifying.
Very good.
At the end anyway. Okay. Good night.
Action item A, approval of minutes for May 31st, 2020. 2022 special school board meeting. Special school board. It's supposed to say special school board meeting.
May 31st.
Can I have a motion to approve the minutes for May 31st?
I motion to approve the minutes from May 31st.
Thank you, Ms. Askey. Do I have a second?
Who put this on here, the action item?
Was it you, Mr. Chin?
Mr. Carlson,
Yes, ma'am.
that was put on there, according to Bellamy, for the stipend, that retention stipend. And they needed that, approved before the deadline.
When's the deadline?
Oh, let me see. I think she said June. I'm trying to remember. I don't remember the date on it, but they were trying to get this out at the next payroll.
It was. Because this is work session. Was that the form 901B?
For
10?
me. Which one?
The form 901B? 10? Is that what she's referring to for the stipend? It was, wasn't it? Because the deadline is 3 weeks from.
It must have been 3 weeks from the second.
I think so.
Yeah. Would you suggest putting it on the meeting on Tuesday?
Mm-hmm.
This is 16th.
Well, when is the deadline? Is Bellamy?
No. Sharon, do you know when the deadline is?
According to Mr. Yazzie, it looks like the 24th.
Okay. We can wait, because normally on work sessions, we're not doing
You can act, you can act action item just as long as it's 72 hours ahead. But we can move it to Tuesday if you like.
I rather keep to that norm than start doing this. Because it's just gonna get confusing. So let's just move it to Tuesday.
It's confusing enough for me.
Yeah.
Okay.
Was it a motion?
Askey, Ms. Askey?
Yes, I'm listening.
You retract that?
Yes, I retract my motion.
Thank you. We do need to table item A.
Is it table or is it just moving the presentation?
Just moving the presentation because there's no action on it.
Right.
And it was retracted. The motion she made was retracted.
So we just need to say
Basically
that.
nullify A.
And just put it back on the agenda
So where it says discussion
for Tuesdays.
for items, but item A moved to Tuesday.
A and then 4.
Do we need,
And then when you make up the agenda for Tuesday, then all of that should fall in.
so 4A?
Yes.
Sharon, you getting that?
Yes, thank you.
Move to Tuesday. Tuesday's meeting. Okay. What other items for?
And that's it. The discussions for board meeting. Yeah, items for the discussions. So you can open that up to the board and who wants what.
She wants you to read number 5.
Go ahead and read number 5 and open it up to the board.
Number 5, discussions, items for June 21. Okay, thank you. 2022 regular school board meeting. Move item A of 4 reports to Tuesday's meeting.
That's
So-
all basically you're gonna do.
Hmm.
It's just one of your
Did I-
suggestions.
But make sure you write it down.
Yeah.
Okay, I mean, just like
MOA, MOU.
the organizational
MIA.
chart and never made it.
I have one. I in the terms of the what is it, the disbursement report, there was a section that I saw in there for $12,000, or maybe it was $12,500 in terms of consultants. Can we also get a list of the consultants, and how are we tracking the effectiveness of the consultants? And that one was for student services or something. I can't remember. It's on the top of the page. It's I can't remember which one it was, but can we find out who are the listing of our consultants, and then have a discussion how to if they're effective or not? Because I think about consultants in regards to kind of like an auditing firm. Are they effective? Are they doing their job? Or have we just had the same consultants for how many years have we had them, and has it been, are they fulfilling, or are we benefiting from their services? That's what I want to know. Thank you.
Ms. Haskey? Yeah.
Yes.
I believe if you may recall, I asked that, I think it's well over a year ago when we were having those discussions about the contractors as well and their efficiency and their effectiveness, and how do we gauge knowing that we're getting our money's worth. So
right.
I appreciate you bringing that back up again, because that's important.
It is. And now that you say it, yes, I remember vaguely, but I remember that. Yes, but that's what I would like to know, if duration of our consultants, and how are those areas doing.
I'd like feedback or report on what happened with the RFP on the audit contractor, how that, where is that at? And I remember we had some concerns about.
Yeah, they were more than 3 years. It was.
So I'd like to hear about that. And
So it was tabled as it was, though, right? So that
yes,
there's nothing else that's been done of it. I think really it would just come to a vote if you wanted to approve one or the other. And then,
well, that's what we need to know.
so would you like Mr. Yazzie to present the auditors again, the same report, or?
No, I believe it was Candace that. Was it Candace that gave that?
We were selecting a new auditing firm for the next 3 years.
Yes, that's fine.
And we opted to go with another auditing firm because the auditing firm that had the highest points was already our auditing firm. So we would be going into year 4 if we utilized them. So I'm not sure if we selected the other auditing firm.
We
There's
did
no
not.
vote.
No
So-
action taken on that.
I hope. Yeah, we said it at the board, but we also said that we wanted, some positions not filled last time and they got filled. So I want to make sure, where is it at? I want to know what the status is on that.
Okay, it would be just where it was. If it were presented, it'd be presented as such. And then you all would vote. So,
And then also like what they're saying is, for the facilities department, they're, who they're, contracting out to, who are their bidders, or who are they giving the jobs to, their company. I'd like to know their names and how long they've been given those contracts. Like they said, there's a 3-year, limit, and then we should change.
That's
So
just
it
for
was
auditor.
It was just for the auditor.
Yeah, but contractors, that's not the same.
And the reason for the auditor changing was that he could pick up different eyes, could pick up things that might be missed by somebody else. But Ms. Aspas and I were having a discussion about having, and I had never heard of this before. Ms. Aspas is probably familiar with it, but the term tabletop audit, isn't that what it was called?
I think so. I don't remember.
And getting someone into.
Was it? I don't even remember. I know it was something audit.
It was.
What are you talking? Like a forensic audit?
That's I guess a lesser form of forensic. It's I don't remember. Maybe you're right.
I think it was called a tabletop
that sounds
audit.
right.
I would just like to have like a listing of all the people who we've done business with, especially in facilities and in student support services, like the big groups and I get that confused all the time.
One thing that they do statewide is contractors will submit their bids to CES, and we can choose a CES contractor, and then we don't have to go through all of the hassle of open bids and three contractors. So, and I know that we've used CES contractors for that reason.
Yeah, and I know of lately, with the last couple of years, we haven't used CES.
In some cases we have.
Yeah, but there's been a lot of times that we could use CES, especially this last week. I talked to one of them, and for a lot of our professional development for our district, we could have used CES, but we haven't been using them. We've been using outside people for years.
I was really surprised to learn that. I mean, they had a vendor out in the hallway there during NMSBA, and I didn't know it was that type of coverage, possible from them.
Well, CES they're already vetted by the state, but sometimes they're not the cheapest.
Mm-hmm. But still, that's never been told to us that's an option. I mean, I haven't heard of it in different areas that they said they do that service. I haven't heard that given to us as a board member, as a board, as an option.
Well, I'm familiar with them because of what we did maintenance. A lot of times.
See, I thought it was strictly maintenance, but I'm learning that it's personal
professional development.
Mm-hmm. Professional development.
No, there's other contractors that are CES contractors other than just maintenance.
And lastly, I would like to have to revisit the land lease. I know that there was supposed to be information forthcoming in regards to Navajo Nation DOJ and the LFC regarding the language of the land lease for TBA. I think it was TBA at the next site. I like to revisit that sooner than later. So that would be, I think it might have been tabled at last in January.
Yes, Mr. Carlson, that was tabled, and one thing that was brought out during that discussion, it was, I guess,
we sent a bid, or we sent a contract to the tribe, and tribe sent it back with adjustments on it. And
no, it wasn't the tribe, it was from state, and I don't know what committee that is.
It was actually the tribe that changed the language, and then it was supposed to go to the state to take a look at it.
No, we were trying to take the language out of Navajo preference. That's where the issue that I had. So it was state trumping the sovereignty. And there was supposed to be some documents forthcoming for us to review in regards to making decision on what the verbiage was going to be.
Can't go deep,
Yes,
can't go deep into this conversation.
Right. That's what that's why I'm saying that this was this discussion, and we need to hear the rest of that, if it was even researched.
Okay, so just jot down discussion about land lease.
Land lease,
what we're doing, because you're starting to have an open conversation about it right here.
Land lease response.
Yes, that's what I'm requesting, because we have to get that done soon for TBA.
Yeah, before they do any type of consideration for construction over there.
Right. So we have to do it soon.
Jermaine
was okay. And you said, I want to hear from Pat on that.
She would be involved in that too as well, because she deals.
And And I didn't know who Pat
And
was
I
at the
believe,
time.
yes, because she's with Navajo Nation Bar.
So both?
Both.
So they need to.
Both.
What did we do with renaming
require
the
the opinion
building
of both
over there?
sides.
Is that
It's still in limbo.
okay? And what about the guy that wanted to anonymous donor?
That's still, I haven't heard anything about that.
I thought they said it was
That
okay.
I thought Yazzie said it was okay
Yeah.
as well, but I
Yeah, it
don't
was
think
on
we
the
moved
action
on it.
item, wasn't it?
Said it was okay.
Yes, yeah, it did come back up and it was, yeah, we did pass it,
Oh, okay.
but I saw concerns over that. But anyway, what was the other thing you told? The memorial. The
Randy
Mr.
Manning. We need to come up with a name.
there already Mr. Manning. His mom named him.
No, not him.
So
Yeah, I think there was.
is it an action item?
We call it the Kirtland Board.
KBO.
KBO.
Business office.
Yeah, it's referred to as that, but even in the announcements. But on the building it has student services, is it? Sharon, do you know?
I think it's called Kirtland Student Services.
On the building?
Yes.
You need to come to some name for the board by the road and then on the building.
So is it a discussion or is it an action item?
Well, we had the suggestion was to consider and have a conversation of renaming that facility after Mr. Manning. Now, I think to her point is to get both namings correctly, so when we do that change, it's done correctly and people know exactly what you're talking about, rather than just saying KBO to this. Whatever the facility is named right now, whatever wording is on it, you take that to be able to utilize it to change to what we want to do. So the discussion would be, and a possible action item of the renaming of KBO, just put KBO for now until
Yeah.
we find out what it is.
/ student services.
Yeah, whatever the official verbiage is on that building.
Okay.
Make sense?
Okay.
Clear as mud?
Number 6.
Wait. Can we get an update for the safety? What's going on with the safety?
That's,
for
I
the
believe we
district?
already have it on there because you had asked that
Oh,
before, so we
okay.
have that.
Okay.
That would be Mr. Burholz who's going to be getting that.
I thought,
Along with Mr. Grego, they'll be there together.
okay, because I'm confused because Mr. Verhos is the COVID-19 coordinator, and then Mr. Griego is the safety coordinator. So why?
They kind of comprise a safety team, and so the two of them can kind of tag back and forth. I mean, there's so many things we're doing right now. They've worked together, and I think you're going to be impressed with the kind of things that are taken care of for next school year.
Two different functions.
Yeah.
Exactly, it's two different.
And as I recall in the hiring, one specialized in.
Exactly.
Okay, I can get Mr. Grego to do it.
Yeah, I think.
I was just going to have the two of them do it together since they would have all the answers to
And
all the
don't-
questions as a team.
And the only way I know that is because when he came on board, it was said publicly. So that's why I don't mean to jump in there, but just
Okay.
that's how.
I think I would like to have titles. Stick with what you interview. Yeah, when you come to interview, you sell yourself and you say that I know this is my education, this is my experience. So use that with your title with your department. And that, you know, and if, yeah.
We'll get that on that.
Okay.
Number 6. I have a motion to adjourn.
Motion to adjourn.
Second,
Second.
Aspen. Or Ms. Askey, I mean, excuse me.
Yes.
Ms. George,
Yes.
Ms. Montoya,
Yes.
Ms. Aspen,
Yes.
we are adjourned.